में पेन हो रहा है, definitely they are talking about some problem related to the liver, right? And the patient recently started experiencing tremors. ये शायद सबको पता होना चाहिए कि when they mention about liver and some neurological symptoms like tremors, okay, this has to be a case of Wilson's disease. That's very important. जब अगर वो liver functions के बारे में डिस्कस करते हैं और neurological symptoms के बारे में डिस्कस करते हैं, it has to be a case of Wilson's disease only. A common condition which affects both of them is only Wilson's. ठीक है. Next important is workup shows that there is liver dysfunction in the patient. Obviously, we know that by the jaundice and the right upper quadrant pain. And the below given ocular finding on slit lamp examination is seen. Now, what does the slit lamp examination show us? यहाँ क्या दिख रहा है definitely? First of all, वहां पे कर दो यार कोई. There's a brown colored ring that you can see, okay, at the limbus. What is limbus? Corneo-conjunctival junction or the corneoscleral junction is what is called as the limbus. यहाँ पे ये brown colored ring दिख रही है, definitely. What is this ring called as? This is known as the KF ring, or we can even call it as the Kayser-Fleischer ring. What is the Fleschner ring then? Very good. Very good. Fleschner ring is nothing but a ring due to deposition of iron in a patient of keratoconus. Very good. So this is not the Fleschner, this is a Kayser-Fleischer ring or the KF ring. And definitely, can you see here the lens? And here also the lens is showing, okay, a cataract or opacity. What is cataract? Cataract is nothing but the opacity in the lens. Normally lens कैसी होती है? Transparent structure होता है. But if there is any opacity in the lens, definitely that is what is known as a cataract. ठीक है, यहाँ पे the cataract which is there, as you can see, this is classically known as which cataract? Sunflower cataract. Okay, so this is definitely a condition which is known as Wilson's disease. Important is the provisional diagnosis in this condition is my Wilson's disease. ये बात बताओ definitely Wilson's disease is copper excess or copper deficiency. So copper excess in the body is what is called as Wilson's disease. And Wilson's disease, which we also know, it is also known as hepatolenticular degeneration. What do I mean by this term? Hepato, matlab this excess of copper is going to deposit inside the liver and it is going to damage the liver. Second, lenticle. What is lenticle? Lenticle is another name for basal ganglia. Excess of copper also deposits in the basal ganglia and it is going to damage that. Particularly the substantia nigra. और substantia nigra कौन सा neurotransmitter release करता है? Dopamine. So if substantia nigra is damaged, will there be release of dopamine? No, there will be dopamine deficiency. And अगर dopamine deficiency हो जाती है, तो patient में classical findings होती है. The patient is going to have pin rolling resting tremors. Second, the patient will have slowness of movements called as bradykinesia. And the third important feature, the patient is going to have rigidity or stiffness. These are the classical triad of Parkinsonism. So as there is deficiency of dopamine in a patient of Wilson's disease, the patient is going to have definitely hepatitis pehle to, due to deposition of copper, and which will finally lead to complete damage of liver. That is called as cirrhosis. Second, definitely the patient is going to have Parkinsonism-like features. Patient is going to have Parkinsonism-like symptoms. And third, important, the patient is going to have ocular symptoms or the eye findings. These are two ones. If this excess of copper deposit inside the cornea, it leads to formation of cataract or ring. Ring. So ring, Kayser-Fleischer ring or the KF ring is when the excess of copper is going to deposit inside the cornea. In which layer of the cornea was the question? Very good. When this excess of copper deposits in the descendants membrane of cornea, that is leading to formation of this KF ring or the Kayser-Fleischer ring. And when this excess of copper deposit inside the lens, that is going to form a sunflower cataract in the patient. Now, important is why the patient is having excess of copper? Because the protein which is responsible for the transport of copper in the plasma, okay, that is known as ceruloplasmin. वो ज़्यादा होता है, कम होता है? कम होता है. There is deficiency of ceruloplasmin in the body. As there is deficiency of ceruloplasmin, the free copper is going to increase. और अगर ज़्यादा free copper होता है, this free copper can deposit at various tissues and inside various organs. No issues with this, anybody? Now, important is, बच्चे, why there is low ceruloplasmin levels in the body? Because of a genetic mutation. And what is that genetic mutation associated with Wilson's disease? It is ATP7B gene mutation. So therefore, as this is a case of Wilson's disease, the likely cause for this condition, we know it is option A, ATP7B gene mutation. No issues with this. Option B says ATP7A gene mutation. ATP7A gene mutation does not cause copper excess. It causes copper deficiency. And that is known as which disease? That is classically known as the Menkes disease. वहां पे the patient will not have any ocular findings. The patient is going to have hypotonia. Patient is going to have muscle weakness. Patient can have brittle, kinky, easily breakable hair. Okay, so those will be the features. High cerebral plasmin or low cerebral plasmin levels? Low. Therefore, definitely option C is wrong. And impaired absorption of iron, is it due to iron absorption? No, it is actually due to copper deposition. So any which ways, option D is also wrong. Important is, what is the investigation of choice for Wilson's disease, bacho? Very good. Investigation of choice for Wilson's disease has to be liver biopsy. And what is the treatment? The drug of choice has to be, very good. The drug of choice has to be zinc acetate. But अगर chelating agent देना है तो zinc chelating agent कौन सा दोगे? Very good. D penicillamine. Liver biopsy. Patho se question. Which stain is used for copper? Rhodamine stain. Copper के लिए जो stain use होता है, that is the rhodamine stain. No issues with this, anybody? So that is the way to study. अगर तुम्हारा पैथो हो चुका है, अगर तुम्हारे बाकी सब्जेक्ट हो चुके हैं, this is what is known as integration. जरूरी नहीं तुम ऑफ्था पढ़ रहे हो मतलब विल्सन उतना ही पढ़ो जितना केएफ रिंग और कैटरैक्ट तक खत्म हो जाए. Try to include everything in it ना, so that is the way. You will not need extra efforts ना. Extra effort चाहिए नहीं होंगे कि फालतू में जब मैं पैथो में जाऊंगा तब उतना विल्सन पढ़ूंगा, जब इधर आऊंगा इतना विल्सन पढ़ूंगा. अरे भाई एक साथ कब लाएंगे? That is the important way. This is the way to study. This is how I study. This is the way you should study. एक बार ये समझ जाओगे ना कि मैं भले ही एक टॉपिक पढ़ रहा हूँ, वो एक सब्जेक्ट से है, मैं बाकी चीजें मुझे जितनी भी आती है उतनी रिकॉल करने की कोशिश करूंगा. This is the way you will never ever try to forget things. ये जो होता है ना कि याद नहीं रहती, क्योंकि हम वो सब्जेक्ट वो टॉपिक उधर ही पढ़ के छोड़ देते हैं, बाद में उसको याद करने की कोशिश ही नहीं होती. So that should not happen. This is what is the KF ring that we have already seen. A brown colored ring at the limbus due to deposition of copper. What is this, bachcho? This is the Christmas tree cataract. And this Christmas tree cataract, as you can see, there is a glare, there is a shine which is there. Yellow and green color shine दिख रही है. तो बस अगर yellow और green color shine दिख रही है, this is the classical Christmas tree cataract which is seen. And that Christmas tree cataract is seen in which condition, bachcho? Strabismus. It is seen in myotonic dystrophy. And I hope all of you are quite aware that in a patient of myotonic dystrophy, what is the pattern of inheritance that the patient follows? It is not a Mendelian pattern of inheritance. It is a non-Mendelian pattern of inheritance, which is there for myotonic dystrophy. And that is called as trinucleotide repeats. Okay. There are trinucleotide repeats की वजह से होता है myotonic dystrophy. And कौन से repeats होते हैं? CTG repeats. T आता है ना myotonic में भी dystrophy में भी. Okay, that is CTG repeats. That you have to remember. No issues with this, anybody? इसी की तरह दिखने वाला दूसरा एक कैटरैक्ट हो सकता है. Okay, but उसमें बस दो कलर नहीं होंगे, उसमें मल्टीपल कलर्स होंगे and a lot of shine will be seen. That is what is called as polychromatic luster. If I talk about polychromatic luster, बच्चे, so definitely please tell me, polychromatic luster is a characteristic feature of complicated cataract. And why it is called as a complicated cataract? Because it is secondary to most common cause. Batao, chalo. Very good. It is secondary to uveitis, that is inflammation, or it can be secondary to tumors, that is malignancies vagara, or it can be secondary to trauma as well. Okay? So these are the main conditions after which the patient can develop a complicated cataract, which will be seen as a polychromatic luster. Luster is shine. Poly means many, chroma means color. तो बहुत सारे कलर्स का शाइन दिखता है तुम्हें इन द लेंस. इंपॉर्टेंट इज व्हिच काइंड ऑफ अपीयरेंस विल बी सीन ऑन स्लिट लैम्प एग्जामिनेशन. वेरी गुड. इन अ केस ऑफ अ complicated cataract, you are able to see a classical breadcrumb appearance. No issues with this, anybody? That's the important feature that you have to remember. Done? Question number 2. It states a 25-year-old executive presents with metamorphopsia. What is metamorphopsia first? Distorted shape. तुम्हें जो शेप है वो भले लेटर का शेप हो या किसी ऑब्जेक्ट का शेप हो, वो तुम्हें डिस्टॉर्टेड लगता है, ठीक है। ये बॉटल मुझे बॉटल की तरह नहीं दिख रही, और फॉर एग्जाम्पल अल्फाबेट डी विच इज देयर, आई एम नॉट एबल टू सी इट लाइक दिस, मुझे उसका शेप कैसा लग रहा है, मुझे उसका शेप ऐसा कुछ लग रहा है, ठीक है। सो द शेप ऑफ द अल्फाबेट और द शेप ऑफ एनी ऑब्जेक्ट is distorted. So distorted image जब बनती है, that is what is called as metamorphopsia. Important is metamorphopsia is a classical feature in which conditions बच्चों? When there is damage to which part of the eye? Very good, macula. So distorted shape या metamorphopsia which is there ना, it is a very classical feature of macular diseases. What is macula? सबसे पहले the central part of the retina. तो सबसे पहले रेटिना होता है हमारा, रेटिना का जो विजिबल पार्ट है which is only visible on fundoscopy. What is that called as? Fundus. Okay, so definitely fundoscopic examination पे जो visible part होता है रेटिना का, that is known as a fundus. उसमें भी जो central part होता है रेटिना का, that is what is called as a macula. The central circle with 5.5 millimeters as a diameter is what is called as the fundus. ठीक है, तो definitely ये जो sorry, it is called as a macula. So any condition which is causing damage at the level of the macula, it is going to cause distorted shape or of the object or a particular alphabet. इसीलिए patient पढ़ पाएगा कि कुछ नहीं पढ़ पाता है, ठीक है। There is inability to read alphabets in the patient, and that is very characteristic of macular diseases. उसके लिए कौन सा टेस्ट करते हो बच्चों मेटामॉर्फोप्सिया के लिए? That test that I do is known as the Amsler's grid. ठीक है, the test which is there is known as the Amsler's grid. Definitely ऐसा पढ़ा होगा ना, ये वाला होता है, crosses are there, and वो crosses का shape distorted लगता है, patient को बोला जाता है इस square के अंदर dot मार, he is not able to see the shape. ठीक है, so that is important. That is the Amsler's grid. So he is having metamorphopsia in his right eye. मतलब उसके right eye में कहाँ पे दिक्कत exactly? Macula पे. See now, if you have known कि metamorphopsia is due to some macular diseases, तो मेरा diagnosis पूरे eye से कहाँ आ जाता, बस macula पे आके रुक जाता, 3-4 conditions पे. That is how you have to come down or narrow down your topics with each symptom which is mentioned. On examination, the fundus shows a shallow detachment at the macula. आगे उन्होंने खुद mention किया, there is problem at the level of the macula also. The fluorescein angiography shows a smokestack sign. Which of the following management should be given? Now, let's see first of all, if there is shallow detachment of the macula, that means retina में detachment है. So please remember, either it can be a complete retinal detachment, जहाँ पे retina ही निकल आया है, or it can be a case जहाँ पे one layer of retina is there. There are how many layers of retina, बच्चे? 10 layers of retina. The outermost layer is known as the retinal pigment epithelium, and the inner 9 layers are known as neurosensory retina. It can be retinal detachment का मतलब पूरा retina निकल आया. All those 10 layers have been detached. That is what is retinal detachment. What do I mean by this? यहाँ पे क्या दिख रहा है? The retinal pigment epithelium is at its place, but the other 9 layers, the neurosensory retina, has been separated from the retinal pigment epithelium. ये वाला जो condition है, okay, this is what is called as CSR. What do I mean by CSR? Central serous retinopathy. यहाँ पे there is separation of the retina, but only at the level of the macula, center में बस, ठीक है. Therefore it is known as central serous retinopathy. See, retinopathy मतलब damage of the retina. Serous मतलब क्या जमा हो जाता है? Serous fluid जमा हो जाता है. And कहाँ पे? Only in the center of the retina. That is what is called as macula. ठीक है, बस macula में जमा हो जाता है fluid. Okay, so therefore there is separation of these layers. And the last one which is there बच्चों, it can be this type, जहाँ पे there is detachment, but यहाँ पे याद रखना जो detachment होती है ना, it is due to collection of fluid, but in cyst-like spaces. अगर cyst-like spaces में अगर fluid जमा होता है बच्चों, and उसकी वजह से detachment होती है, that is what is called as CME. What is CME? Cystoid macular edema. So edema is nothing but collection of fluid. Cystoid मतलब there is collection of fluid, but in cyst-like spaces, balloon जैसे spaces में है. And where it is at the central part of retina, that is your macula. कोई दिक्कत नहीं है. These are the three parts. These are the three differentials when they say there is shallow detachment at the level of retina. Now smokestack sign बोली उन्होंने fluorescein angiography पे. So let's see this. Important is बच्चों, definitely if I talk about this, this is what examination बताओ मुझे बस. This is which examination? This is nothing but fundoscopy because we are able to see the retina over here. So retinal examination is done by fundoscopy. Now is fundoscopy pe dikh raha hai? There is a halo which is seen. Can you see this halo in the central part of the retina? Okay, this halo is due to collection of fluid, and collection of fluid only in the central part of retina is what is called as CSR, that is central serous retinopathy. कोई दिक्कत नहीं है. Next important, if a patient is having central serous retinopathy, okay, इसका most important cause क्या होता है? Stress. The most important cause of your central serous retinopathy is stress usually. ठीक है. Next important is अगर ये central serous retinopathy का मैं ये क्या है, कौन सा इन्वेस्टिगेशन है? Very good. It is FFA. What is FFA? Fundus fluorescein angiography. Angiography, ग्राफी का मतलब पिक्चर, एंजियो का मतलब वेसल्स. ओके, कौन सी वाली? फंडस की वेसल्स. एंड मैं उनको हाईलाइट करने के लिए मैंने कौन सा डाई इंजेक्ट किया उसमें? फ्लोरोसिन डाई. Therefore, this investigation is known as fundus fluorescein angiography. ये क्वेश्चन था कि where do you inject this fluorescein dye? In which vessel of the body? It is the antecubital vein. That is the vein which is used for injection of this fluorescein dye in the body. Important is यहाँ पे, can you see the retinal vessels are highlighted so that if there is any problem with the retinal vessels, you are easily able to pick that up. That is what is done by fundus fluorescein angiography. Now here, definitely, can you see the fluid, the fluorescein dye is leaking out, and that is leaking out in a classical manner. That is known as the ink blot pattern. So this is the classical ink blot pattern that you have to remember. This is the most common. This is the most common angiography feature in a patient of central serous retinopathy. But on the other hand, again the fluid is leaking out. बस किस shape में leak out कर रहा है? Mushroom shape. We can call it umbrella shape, or we can even call it smokestack appearance. So if the fluorescein dye is leaking out in the mushroom shape, umbrella shape, or a smokestack pattern, you have to remember that is the most characteristic feature of central serous retinopathy. Characteristic का मतलब it will only be seen in a case of CSR, not in any other condition. तो उन्होंने अगर classically mention किया था question में that the patient is having a smokestack appearance on the fundus fluorescein angiography, so diagnosis has to be CSR. Okay, so your question is the diagnosis of CSR. What is this investigation, bachcho? Just identify the investigation. Yahi pucha tha question. Very good. It is what is OCT. That is your optical coherence tomography. And on this optical coherence tomography, जो मैंने दिखाया था वही दिख रहा है ना? There is collection of fluid between the retinal pigment epithelium and the neurosensory retina. Due to that, there is separation of these layers, and that is what is CSR. That will be further used for confirmation of CSR, and second to differentiate CSR from CME, क्योंकि इसी पे दिखेगा वो. ठीक है? Next important is this, बच्चों. ये भी क्या है? Fundoscopy. On this fundoscopy, which kind of appearance is seen? On fundoscopy, we can see a classical honeycomb appearance. Okay, fundoscopy showing a classical honeycomb appearance is a feature of. Very good. It is a classical feature of CME, that is cystoid macular edema. क्योंकि मैंने क्या बोला, यहाँ पे there is collection of fluid, but in cyst-like spaces. तो वो थोड़े-थोड़े spaces, pockets में जमा होता है. इसीलिए you will get this classical honeycomb appearance. Whereas if I do a fundus fluorescein angiography, उस पे कैसा appearance दिखता है मुझे? This is the flower petal बोल सकते हो, or I can call it as the petaloid appearance. Flower petal or the petaloid appearance is what is classically seen on the fundus fluorescein angiography. That is also a classical feature of CME or cystoid macular edema. Okay? And lastly, what is this? OCT. On that optical coherence tomography, here also you see separation of the neurosensory retina from the retinal pigment epithelium. But this separation is due to collection of fluid. But this fluid is collected in which manner? Cyst-like manner. Therefore, this is a case of cystoid macular edema. Cystoid macular edema is commonly associated with which condition? Diabetic retinopathy. Very good. So, cystoid macular edema is commonly associated with diabetic retinopathy. Which one? Proliferative or non-proliferative? It is seen in non-proliferative diabetic retinopathy usually. Okay? Rather, I would say that please remember cystoid macular edema is the most common cause of loss of vision in a patient of diabetic retinopathy. It is the most common cause of loss of vision in a patient of diabetic retinopathy. What is the most common cause of loss of vision in a patient of diabetes mellitus? Very good. It is the snowflake cataract. What is the most common cause of loss of vision in diabetic retinopathy? I've told you it is CME, cystoid macular edema. And what is the most common cause of sudden loss of vision in a patient of diabetic retinopathy? Vitreous hemorrhage. So in proliferative diabetic retinopathy हमें पता है क्या होता है, नियो एंजियोजेनेसिस, नए वेसल्स बनते हैं, बट ये नए वेसल्स जो होते हैं they are easily ruptured and therefore that can lead to formation of vitreous hemorrhage and that can lead to vision loss. So most common cause of sudden loss of vision in a patient of diabetic retinopathy, the answer has to be vitreous hemorrhage. कोई दिक्कत नहीं है. Coming back to our question, so what is our diagnosis now? Our diagnosis has to be a case of CSR, central serous retinopathy, क्योंकि smokestack sign is classically seen in this patient. Important is बच्चों definitely which of the following management should be given in this patient. Important is for CME वाला patient, what is the management? The management is steroids. But what is the management for a patient of CSR? Very good. The management for a patient of CSR is nothing, observation, that is wait and watch, because this is a condition which is self-limiting in nature. अपने आप ठीक हो जाएगी. So option A says topical antibiotic corticosteroid combination. No. Option B says systemic corticosteroid for 2 weeks and then taper. No. Pulse methylprednisolone for 3 days and then taper. No. Answer is option D, just wait and watch for spontaneous recovery. अगर थोड़ा लॉजिक लगाते, तीनों ऑप्शन में कॉमन चीज क्या थी? स्टेरॉइड्स. तो अगर तीनों ऑप्शन में स्टेरॉइड्स है तो ऑब्वियसली स्टेरॉइड्स तो आंसर नहीं होना चाहिए ना यार. So this is what is the thing. Logically or rationally भी क्वेश्चन सॉल्व किए जा सकते हैं. Question number 3. A 25-year-old male who works in a fertilizer factory suddenly had an accident in the factory where the pipeline burst open and there was sudden gush of chemicals in his eyes. He was brought immediately to the emergency room with complaints of pain. What is epiphora? Epiphora is nothing but excessive watering from the eyes. Then he is having blepharospasm. That means inability to open the eyes. Patient आंखें नहीं खोल पा रहा due to spasm of the eyelids. That is blepharospasm. And there is reduced visual acuity. अच्छे से दिख नहीं पा रहा उसको कुछ. What is the best line of management? What is the diagnosis over here? Here the diagnosis is a classical case of chemical burns to the eyes. Okay, as these chemicals have entered into his eyes, definitely it is a case of chemical burns. Chemical burns can be of two types. Either it can be alkali burns or acidic burns. Which are more dangerous? Shabash. As alkali burns are more dangerous because they are known to cause liquefactive necrosis, whereas acids on the other hand cause coagulative necrosis. कोई दिक्कत नहीं है. So that is the important reason. And as he is working in a fertilizer factory, he is known, he's having more chances that he might have a alkali injury. ठीक है, caustic potash वगैरह होता है बहुत ज़्यादा इनमें. So that's the reason. Now, what is the best line of management that you have to answer? So option A says deep anterior lamellar keratoplasty. सबसे पहले plasty is what? Repair. Kerat का मतलब cornea. ठीक है, lamellar is layers. ठीक है, तो ये सबसे पहले ये बताओ तुम्हें अभी सर्जरी करनी है क्या, कोई रिपेयर ऑफ कॉर्निया करना है क्या? ऑब्वियसली नो. दिस इज द सर्जरी व्हिच कैन बी डन इन अ पेशेंट ऑफ जहां पे डिफेक्ट हो कॉर्निया में, केराटोकोनिस. नेक्स्ट इंपॉर्टेंट इज ऑप्शन बी सेज टॉपिकल एंटीबायोटिक्स विद स्टेरॉइड्स. सी इंपॉर्टेंट इज एंटीबायोटिक्स विल बी गिवन टू दिस पेशेंट फॉर कवर, बट इज इट द फर्स्ट और द बेस्ट लाइन ऑफ मैनेजमेंट? नो. सो दैट इज नॉट डन. ऑप्शन सी सेज रिमूवल विद अ 26 gauge needle. इट इज यूजुअली डन फॉर अ फॉरेन बॉडी. अगर कोई मेटालिक फॉरेन बॉडी हो, जैसे अ वेरी स्मॉल आयरन मेटल चिप, ओके, अ वेरी स्मॉल आयरन मेटल चिप, डेफिनेटली यूजुअली इन अ वर्कर और अ वेल्डर, उसके लिए यू रिमूव दैट फॉरेन बॉडी विद द हेल्प ऑफ अ 26 gauge, अ वेरी स्मॉल नीडल. ठीक है, एंड अलोंग विद दैट एंटीबायोटिक्स आर गिवन. सो दैट इज आल्सो नॉट डन. सो आंसर इज ऑप्शन डी, कोपियस सलाइन इरिगेशन. कोपियस मतलब बहुत ज्यादा. You wash his eyes with a lot of saline usually. ठीक है, so definitely for a span of like almost 15 to 30 minutes, you have to wash his eyes, okay, continuously with a lot of saline irrigation. Matlab you have to take a syringe and you have to push, you have to keep pushing that syringe, saline inside his eyes. So whatever chemicals have went into his eyes, they will be washed off and the damage should be minimized. ठीक है? So answer for this question has to be copious saline irrigation. ये देखो, ये है तुम्हारी छोटी सी metallic foreign body. This is a previous year image based question which has been asked. So for this metallic foreign body, definitely I would have answered it as 26 gauge needle के साथ removal, not for a case of chemical or any type of acidic or alkali burns. ठीक है? And what is this? Definitely this is due to this is due to a trauma of the eye. And trauma की वजह से क्या होता है? Definitely. So first of all, there is subretinal hemorrhage which is occurring, and second important, there is commotio retinae. What is commotio retinae का दूसरा नाम? Berlin's edema. Very good. So there is nothing else but edema, okay, in the retina. Okay, this is classically known as the Berlin's edema, which occurs due to trauma in a patient. Okay, which occurs due to trauma in a patient, that is known as commotio retinae or Berlin's edema. Next important, these are the important things of trauma. So सबसे पहले ये पहला वाला क्या है? So lens में कोई ना कोई opacity दिखती है. Lens की opacity is known as cataract. As this cataract is seen in rose petal like fashion, therefore this is classically known as the rosette cataract. Sarkari question पहले था. This rosette cataract is associated with which kind of trauma to the eye? It is associated with blunt trauma to the eye. That has to be remembered. What is this, बच्चों? Very good. There is blood inside the anterior chamber of the patient, that is known as hyphema. So blood inside anterior chamber is hyphema, and pus in anterior chamber is hypopyon. Very good. So this is also seen in cases of trauma to the eye itself. Okay. Next important. What is this? किस shape का pupil दिख रहा है? D-shaped pupil is usually seen. Why? Because the base of the iris has been detached. Okay, the base of the iris has been detached usually. So you have to remember, this is nothing but iridodialysis. So iridodialysis is also due to high velocity trauma in a patient, and the patient is going to have a classical D-shaped pupil in this condition. Okay. Next important is this. What is this? ये देख पा रहे हो? This is what is the ring over here. This ring which is there, it is due to deposition of pigments on the lens. अब ये क्यों हुआ? Because patient was traveling in a car, for example, and he suddenly applied a brake. As he suddenly applied a brake, he had a concussion trauma. What is concussion trauma? There is sudden hyperflexion and hyperextension. ठीक है? उसकी वजह से क्या होता है? Your lens comes in contact with the iris. Okay, your lens comes in contact with the iris, and the iris is going to deposit its pigments on the lens. या iris अपने pigments किस पे छोड़ देगा? Lens पे छोड़ देगा, and that will form a ring, and this is classically known as the Washius ring. Okay, this is known as the classical Washius ring. So this has been a previous year image-based question. This is a classical Washius ring which occurs in a patient of concussion trauma. कोई दिक्कत? Next important, what is this? Definitely bleeding दिख रही है ना? So it is a hemorrhage. But which shaped hemorrhage is seen? There's a boat-shaped hemorrhage. Now जैसा है ना? So this is a classical boat-shaped hemorrhage which is seen. Okay, this is a classical boat-shaped hemorrhage which is seen in the patient, and this is what is called as the subhyaloid hemorrhage. This is what is known as the subhyaloid hemorrhage. ये hyaloid fissure जो होता है, okay, it is present in the fetal life. ये hyaloid fissure कब बंद होता है? Very good. 6 to 7 weeks. Okay. So please remember, the hyaloid fissure usually closes by 6 to 7 weeks of the intrauterine life. अब ये जो hyaloid fissure होता है, definitely, if it does not fuse or if it does not close, persistent रह जाता है, तो the congenital anomaly which is formed is known as coloboma. Very good. Important is याद रखना है कि अगर hyaloid fissure does not fuse or the hyaloid fissure does not close, उसकी वजह से जो abnormality या congenital anomaly होती है, that is known as coloboma. Very good. Next is nothing but this is the fundus fluorescein angiography, where it is showing a vitreous hemorrhage itself, where the dye is leaking out from the vessel. The ruptured vessel से dye बाहर leak out कर रहा है. What is this classical sign? This is the NCCT, which classically shows us the teardrop sign. Here we can see the soft tissues of your orbit are coming down inside the maxillary sinus. Why? Because the floor or the inferior wall of your orbit has been fractured. And this kind is known as which fracture? Blowout orbital fracture. This is a classical case of blowout orbital fracture. And blowout orbital fracture is due to which kind of a trauma? Penetrating or blunt? It is due to a blunt trauma, something like a tennis ball injury, very commonly told. No issues with this, anybody? So the most common wall to fracture in a blowout orbital fracture is the inferior wall of the floor. But the weakest wall, if they ask you, it is the medial wall. Why medial wall is not fractured then? Very good. Because it is protected by the nose usually. No issues with this. Next important is this. क्या दिख रहा है ये? This is nothing but a horseshoe shaped ear. Okay. So this is nothing but a horseshoe shaped ear or a bucket handled ear, we can call it. Horseshoe or a bucket handled ear. And this horseshoe or a bucket handled ear in the retina is seen in which condition? RRD. What is RRD? Shabash. Rhegmatogenous retinal detachment. Rhegmatogenous matlab due to tear. Okay. Due to tear in the neurosensory retina or the inner 9 layers of retina. अगर retina detach हो जाता है from the retinal pigment epithelium, that kind of retinal detachment is what is called as the rhegmatogenous retinal detachment. It is commonly due to trauma, and please remember the most common type. There are 3 types of retinal detachment. One is rhegmatogenous, second is tractional, and the third is exudative. The most common type is rhegmatogenous retinal detachment, which occurs due to trauma itself. ठीक है? Tractional retinal detachment. Traction का ही मतलब क्या होता है? Pull. Okay, so tractional retinal detachment is due to pull of the retina by the newly formed vessels. I'll talk about that, okay, in a while. Third important is exudative retinal detachment. Exudation का मतलब क्या? Collection of fluid. But which kind of fluid? Inflammatory or non-inflammatory? Transudate and exudate. Exudate is an inflammatory fluid. Transudate is a non-inflammatory fluid. ठीक है? तो exudative retinal detachment का मतलब there is collection of inflammatory fluid. अब that inflammation can occur due to most commonly infections. Second cause can be malignancy or the tumors usually. ठीक है? तो usually infections and malignancies are the more common causes of exudative retinal detachment. वहां पे पानी भर जाएगा inside the retina. Due to that, the retina separates from the layers. Okay, and this is what is exudative retinal detachment. कौन सी साइन दिखती है उसमें? वो पानी जो भरेगा वो हिलता रहेगा. That is what is called as shifting fluid sign. And this was a previous year's one-liner question. Shifting fluid sign is seen in. Answer was exudative retinal detachment. Okay, so that's important. That was all about your trauma, ocular trauma. Question number 4, if I talk about, it states a young boy presents to the ophthalmology department with decreased vision. There are 6 months after being hit by a tennis ball in the eye. Which of the following findings on optical examination is suggestive of blunt injury to the eye? Now, option is important is they have given history of which type of injury to the eye? Blunt injury to the eye. Okay, and as they have already mentioned about a tennis ball injury in the patient. Now, the patient presenting to us after 6 months. What is the likely finding? Option A says optic neuritis. What is it? It is inflammation. Neuritis means inflammation of the nerve. Which nerve? The optic nerve. That is your second cranial nerve. Optic nerve कहाँ होती है? आगे या पीछे? For example, this is your eyeball. ठीक है? Definitely from this eyeball there is optic disc, and then finally there is continuation of the optic nerve, right? So definitely if you want to reach till the optic nerve, bachcho, okay, can it happen with the blunt trauma? No. The infection of the optic nerve will only happen if there is some penetrating injury. If there is some penetrating injury which is going to take the infection till the optic nerve. So अगर penetrating trauma होता, then definitely chances of optic neuritis would have been there. Blunt trauma mein there is no chance of infection. How it is going to reach till the optic nerve? So therefore optic neuritis cannot be a case. Option B says pars planitis. Again, what is it? Is inflammation. What is pars plana? A part of the ciliary body. So we have 3 layers in the eyeball. The outermost is the protective layer of the eyeball, which is fibrous in nature. The posterior 4/5 is made by the white color layer known as sclera, and the anterior 1/5 is made by a transparent structure known as cornea. It is avascular, therefore it is transparent in nature. Then the middle layer is vascular. That means it contains blood vessel. That vascular layer is known as uvea. Uvea को मैं आगे से पीछे तक बोलूं तो uvea first of all will have a pigmented structure known as the iris, and the small space between the iris is known as the pupil. The first part of definitely your uvea is to be the iris. Then definitely we have the ciliary body, and then definitely we have the choroid. This ciliary body which is there, it has two parts to it. जिसमें finger-like projection होंगे, that is called as pars plicata, and जिसमें plain होगा, that is called as pars plana. Pars plicata is responsible for the secretion of which fluid? Aqueous humor. Aqueous humor. This was a previous year question. Aqueous humor is secreted by pars plicata, and it is drained by two important pathways. 90% drainage occurs by the trabecular meshwork, but 10% of it occurs via the ovioscleral pathway from the ovioscleral tunnel. Okay? That is important. And the innermost layer of your eyeball is known as retina, which is a neural layer which contains the photoreceptors and the bipolar neurons. The anterior most termination of retina, which is also considered as the thinnest portion of retina, is ora serrata, and that has been a previous year question. Which among the following is the thinnest portion of retina? Answer is ora serrata. Okay? Coming back, pars plana was a part of your uvea itself. Okay? So अगर मैं यहाँ निकालूं, this is my iris for example. Okay? This is my ciliary body, that is pars plicata. This is my pars plana, and then definitely it will be my choroid which will be there. Okay? And ये अंदर वाला जो होता है मेरा retina होगा. And this anterior most termination of retina is known as ora serrata. तो बच्चों अगर मुझे वापस इन्फेक्शन करवाना है पार्स प्लाना का, okay, can it happen with a blunt trauma? No, I need to have a penetrating injury till the pars plana so that an infection can be taken till the pars plana, and that is going to cause pars planitis. ठीक है? So again, a blunt trauma of eye cannot cause pars planitis. ठीक है? Option C and D are there. Option C says vitreous based detachment. Yes, it can happen. Option D says equatorial edema. There are chances of both of them. But अगर definitely patient is saying बच्चों कि the patient is having decreased vision, okay, and that too for almost 6 months after the injury, so the more likely diagnosis should have been option C, that is vitreous based detachment. Equatorial edema can happen, that is this edema. Okay, so please remember, but usually the chances of equatorial edema अगर है, so please remember in a case of equatorial edema, first of all blunt trauma के बाद equatorial edema के chances कम होते हैं. And even if it occurs, the patient will not have it for such a long time. Okay, the condition is going to improve in a while. Okay, no issues with this. Question number 5. It states that the patient in the image is a 65-year-old male, complains of gradual painless loss of vision. For those who are new now, ophtha will get simple. Okay, definitely when you can just make 3 tables out of it. 3 tables क्या होने चाहिए? First is gradual painless loss of vision. Second should be the column of sudden painless loss of vision, and third is the column of sudden painful loss of vision. Okay, so I'll be sharing it in the group itself. I have the list, but please feel free to add more into that list. Okay, और थोड़ी मेहनत अगर खुद कर सको तो that would be better. ठीक है? So gradual, because see, याद रखना ऑफ्था में this is the classical hint. If they say gradual painless loss of vision, my diagnosis will come down to 6 or 7 topics. That's it. मुझे पूरे ऑफ्था के बारे में सोचने की जरूरत नहीं है फिर. ठीक है? So that is the classical hint for your ophthalmology. This is the way to tackle your questions. So first of all, the patient is having gradual painless loss of vision, and that to an elderly male, right? 65-year-old, that to an elderly male. On examination, visual acuity in the right eye is how much? 3/60 definitely. Okay, and the fundus of the patient is not visible. A fundus, that is retina, visible नहीं है. क्यों? क्योंकि रेटिना के आगे शायद कुछ ना कुछ ओपेसिटी हो गई है. नॉर्मली रेटिना क्यों दिखता है हमें? क्योंकि 2 ट्रांसपेरेंट स्ट्रक्चर्स होते हैं. फर्स्ट इज डेफिनेटली द कॉर्निया, सेकंड इज डेफिनेटली द लेंस. Because of these 2 transparent structures, we are able to properly visualize the retina. But अगर इन्हीं 2 transparent structures की transparency lose हो गई, if there is an opacity in these 2 structures, that is going to cause problems. Now, it can be a case of corneal opacity or it can be a case of lens opacity, that is a cataract. हमें दोनों हो सकता है, definitely. But problem is corneal opacity in patient of this age is less common as such. Corneal opacity is more common in children usually. That has to be remembered. First thing, chalo. Then also we will consider both of them. He was brought to the ER with worsening of vision hota hai usme, and there is also pain now. His intraocular pressure was found to be raised on tonometry And tonometry, I hope all of you are quite aware. Tonometry is the investigation which will tell us about the intraocular pressure. What is the normal intraocular pressure? 10 to 21 millimeters of mercury is the normal range of your intraocular pressure, definitely. Okay, if the pressure is too high, definitely that is called as raised intraocular pressure. Along with that, if the patient is having optic nerve defects and visual field defects, this classical triad is known as glaucoma. Yaad rakh lena, please remember that if these three features are not present together, that is not a case of glaucoma. IOP अगर normal होगा and बाकी दो features है, so that is a normal tension glaucoma which can be there. But otherwise it is not glaucoma then. ठीक है? So that has to be remembered. And next is the gonioscopy. तुम्हारी जो gonioscopy है, it is reveals an open angle. Again, this was a previous year question. Which among the following investigation is used to check the angle? So we know the anterior chamber का जो angle है, वो देखने के लिए कौन सा investigation use होता है? Gonioscopy. And that gonioscopy tells that the angle is open, definitely. What is the likely cause? So सबसे पहले, so this is an elderly patient, gradual painless loss of vision, vision कम हो गई और fundus is not visible. Either a case of corneal opacity or a cataract. क्या दिख रहा है यहाँ पे? This is a case of cataract. Okay, and कौन सा type का cataract? Hypermature cataract, definitely. And this hypermature cataract, क्यों बोल रहे हैं हम इसको? कौन सा appearance दिख रहा है? Bag of milk appearance. This is the classical bag of milk. Apart from the bag of milk appearance, bache, can we see that the nucleus of the lens, which is usually present in the center, that has sink down. Okay, the nucleus which is there of the lens, it is sinking down. So a sinking down nucleus. क्यों? क्या हुआ है इसमें? This is a case of a hypermature cataract. Now hypermature cataract are of two types, na? One is a Morganian cataract, another is a sclerotic cataract. अब ये Morganian cataract में क्या होता है? There is liquefaction of the lens. मतलब जो lens का material होता है वो liquefy हो जाता है. Okay, so जो gel like material होता है ना वो पूरी तरह से liquefy हो जाता है. And as it gets liquefied, so the proteins of the lens will start leaking out. And as these proteins or the cells will start leaking out, बच्चों, definitely these proteins are going to block the trabecular meshwork. And as they block the trabecular meshwork, will there be drainage of your aqueous humor? No. So the amount of the volume of aqueous humor keeps rising, and that is going to cause increased intraocular pressure. And this is what is a case of glaucoma. But as it is due to damage to the lens, it has to be called as a lens is called as phaco. Damage is called as lysis. So it is a phacolytic glaucoma. First thing. Second is sclerotic cataract. Sclerotic cataract में क्या हो जाता है? There is sclerosis or there is fibrosis of what? Zonules. For example, this is your lens. Okay? And I hope all of you are quite aware. This lens which is there, it is hanging at the right place because of this zonules, also known as the suspensory ligaments, which are connected to the ciliary body. But in a case of a sclerotic cataract, which is a type of hypermature cataract, इसमें क्या हो जाता है? There is fibrosis or there is sclerosis of these zonules. Okay, as there is fibrosis or sclerosis of the zonules, these zonules are going to contract, and therefore they are going to pull the lens here and there. So one thing that they cause is definitely lens subluxation. That is called as ectopia lentis. So one thing definitely they can cause is ectopia lentis. Okay. And अगर उन्होंने ectopia lentis करा, they has caused subluxation of the lens. उसकी वजह से उन्होंने क्या कर लिया? The lens, it came into the anterior chamber. As the lens came into the anterior chamber, the lens blocked the angle. The lens has blocked the angle now, and as the lens blocker, see, lens normally hang in करती है, but अभी ये zonules जो है वो definitely fibrosis होने की वजह से एक तरफ खींच रहे lens को. Therefore the lens has been pulled, and therefore that has blocked the angle usually. And as it is blocking the angle, again, will there be drainage of aqueous humor? No. So again, there is no drainage of aqueous humor. Therefore the amount of volume of aqueous humor is going to rise, and therefore intraocular pressure is going to rise, and therefore the patient will develop a glaucoma, and that type of glaucoma is known as a phacotopic glaucoma. Okay, that is what is known as a phacotopic glaucoma. Phacotopic मतलब due to location, okay, due to position of the lens, अगर it is causing glaucoma, that is a phacotopic glaucoma definitely. Okay, so अपने patient में क्या है? There is a classical liquefaction of the lens, जिसी की वजह से we are able to see the bag of milk appearance, and as the lens is liquefied, so can it hold the nucleus in the center? No. पानी अगर भर जाता है तो nucleus is going to sink down. That is the reason it is a case of Morgagnian cataract. The diagnosis of a question is a classical case of Morgagnian cataract. Okay, where there is liquefaction of lens. So अगर Morgagnian cataract है तो कौन से टाइप का ग्लाउकोमा होता है? Phaco. So answer is option C, phacolytic glaucoma. Phacotopic, as I've told you, it is associated with the sclerotic cataract. And phacomorphic is due to very good. Shape of the lens changes. If the shape of the lens changes usually, that is going to cause a phacomorphic glaucoma. Morphology is shape and size. ठीक है, तो अगर shape of the lens is going to change, for example, if there is a mature senile cataract, okay, that is going to imbibe a lot of fluid, and that can lead to swelling of the lens. And as the lens gets swollen up, it is again going to close the angle. Agar again angle is going to close, there will be no drainage of aqueous humor. Amount of aqueous humor keeps on increasing, intraocular pressure keeps on rising, and that is what is glaucoma. As it is due to change in the shape of the lens, therefore it is called as phacomorphic glaucoma. That is seen in a case of senile cataract. No issues with this, anybody? And what is glaucom flecken, bache? So glaucom flecken is nothing but जब कचरा जमा हो जाता है. Basically, glaucom flecken is nothing but when a lot of debris get collected over the lens surface after an attack of acute angle closure glaucoma. अगर acute angle closure glaucoma हुआ तो बहुत सारे cells वगैरह, proteins वगैरह आए थे, and those all get deposited over the lens, and that is what is called as glaucom flecken. No issues with this, anybody? If I talk about cataract, as I've already told you, cataract is nothing but opacity inside the lens, and due to that, definitely the patient is going to have loss of vision. ठीक है? So cataract की अगर मैं बात करूं, what is the most common cause of cataract? The most common cause of cataract is old age. That is what is we can call senility. ठीक है? And we know the cataract is also the most common cause of blindness, or I can also say cataract is also the most common cause of ocular mortality or morbidity. Mortality. Ocular mortality. What is the most common cause of ocular morbidity then? Refractive error. Morbidity का मतलब होता है disease. So the most common cause of ocular morbidity is refractive errors, myopia or hypermetropia. No issues with this. That is important. Now, which are the most common drugs responsible for cataract? Very good. The most common drugs responsible for cataract are going to be the steroids usually. कोई दिक्कत नहीं यहाँ तक. That's important. Now, when the cataract starts, सबसे पहले क्या होता है लेंस में? The layers of the lens they starts getting separated. Okay, layer को क्या बोला जाता है? Lamella. Therefore, the first stage is lamellar separation. Second is the stage of incipient cataract. यहाँ पे glare दिखाई देता है तुम्हें. ठीक है? Here you can see a shine of the glare inside the lens usually. Okay, flares या glares. Then after incipient cataract, definitely there will be a stage of immature senile cataract. Finally, it will turn into a mature senile cataract. Mature senile cataract में मोती जैसा appearance दिख रहा है ना? That is what? Pearly white appearance. That is a classical pearly white appearance. And this mature senile cataract is finally going to land up into hypermature cataract. And this hypermature cataract can be of type of Morgagnian cataract, where there is liquefaction of lens causing bag of milk appearance and sinking down of lens. कोई दिक्कत नहीं है इसमें. What is the treatment of choice for cataract? Definitely surgery करोगे. And the best surgery for cataract, which is commonly used nowadays, it is phacoemulsification. Previously, we used to do ECCE or ICCE. What is ICCE? Intracapsular cataract extraction. What is ECCE? Extracapsular cataract extraction. Then we came up with phacoemulsification. Nowadays, we also use flax at times. What is flax? Femtolesistor assisted cataract surgery. We also do mix at time or 6 at time. What is that? Small incisional cataract surgery or a micro incisional cataract surgery. But what was the problem with ICCE? ICCE में क्या problem थी? Definitely we used to remove the whole capsule. So was there any site for placement of the new intraocular lens? No. So the new intraocular lens was not able to be placed. Then what was the problem with ECC? Definitely posterior capsule tha. Okay. But we used to place the intraocular lens. But the problem was the incision that we used to make. Incision bada tha. So we have to close that incision with the help of sutures. And जब तुम sutures मारोगे, the corneal surface will be irregular. And अगर corneal surface irregular होगा, तो image एक point पे बनेगा, बहुत सारे points पे बनेगा. बहुत सारे points पे. And that is what is astigmatism. That is an important complication after cataract surgery known as astigmatism. Okay, no issues with this anybody? Therefore we thought कि हम incision छोटा 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 करते जाए. Therefore we came up with phaco, then we came up with 6, then we came up with mix, and now we have thinking about flax. But still usually the better surgery which gives a better outcome is usually phaco emulsification. कोई दिक्कत नहीं है इसमें? That is important. Question number 6 now. It says an infant was brought to your clinic with below given ocular finding, and there is history of recurrent vomiting, and there is failure to thrive. On examination, hepatosplenomegaly is noted. What is true about the management of this child? What is your provisional diagnosis? So let me give you a logic. Important is जो नहीं पढ़ के आए थे ना उन्होंने सब चीजों के बारे में सोचा और जो हफ्ता पढ़ के आए थे ना उनको लगा ये हफ्ता का क्वेश्चन है ना यार इसमें थोड़ी ये डालेंगे. So important is you have to keep your minds open. Question आ रहा है वो कहीं से भी आ सकता है. So an infant was brought to your clinic with ocular finding which is given. क्या लग रहा है? आंख में तेल की बूंदे ऐसा नहीं लग रहा. तो वो हमेशा ऑरेंज कलर की इमेजेस थोड़ी आएगी. So this is a classical oil drop cataract. And we have to remember that oil drop cataract is the only reversible or irreversible? It is the only reversible cataract. Matlab, if you stop giving galactose to the patient, the cataract will get reversed. बाकी कोई cataract reverse नहीं होता. We have to treat it by surgery itself. ठीक है? So definitely, if I talk about this, definitely history of recurrent vomiting is there in the child. ठीक है? And there is failure to thrive. What is failure to thrive? Inability to gain weight. बच्चे का वजन नहीं बढ़ पाता है. Okay, and there is also hepatosplenomegaly. अब ये सब features क्यों है? Because the child was not able to digest what? Galactose. Galactose is a monosaccharide which is present in lactose, and lactose is in turn present in milk. So when this child was given milk which contains galactose, this galactose was not able to break down. Why? Because two enzymes are required. One is known as galactokinase, and second, what is the rate limiting enzyme? The rate limiting enzyme is GAL1 put galactose 1-phosphate uridyl transferase. Galactokinase deficiency only causes cataract. That is called as a minor type of galactosemia. इसमें बस cataract दिखाई देता है. That is a minor type of galactosemia, and definitely GAL1 put deficiency. GAL1 put deficiency, which is the rate limiting enzyme. इसमें बस cataract दिखेगा क्या? नहीं. Along with cataract, the patient is going to have what? Malabsorption symptoms. What are malabsorption symptoms? Digest नहीं होगा ना galactose. So the patient is going to have nausea, vomiting. There will be diarrhea because galactose pulls up a lot of water. So that is going to cause diarrhea. This galactose will be converted by the intestinal bacteria into gas, and that is the reason patient will have flatulence or bloating sensation. इसी की वजह से vomiting भी होती है patient में. Okay, and this excess of galactose, it is not getting digested. So usually excess of glycogen which is broken down, and if it is converted to galactose, it will keep on collecting inside the patient's liver and spleen, causing hepatosplenomegaly. No issues with this anybody? That's important. Important is you have to remember that if there is excess of galactose in this patient, what is going to happen? This excess of galactose by an enzyme known as aldose reductase will convert galactose into its alcohol form, reduce kar dega wo, and that is what is called as galactitol, also known as dulcitol. And this excess of galactitol or dulcitol will go inside the lens, And as a deposit inside the lens, we know galactitol, dulcitol, these are hygroscopic sugars. Hygroscopic means they attract water. And as they attract water inside the lens is going to lose its transparency. And that is going to form a cataract. As more water is coming inside the lens, that is leading to formation of cataract. Okay, that is a oil drop cataract which is seen. Same funda pe diabetes mellitus wala patient also develops a cataract. Over there, excess of glucose is converted to its alcohol form known as sorbitol or polyol, and that sorbitol collects inside the lens of the patient. This is a hygroscopic sugar, therefore it attracts a lot of water, and therefore there is the lens is causing opacity. There is loss of transparency, and that is what is known as a snowflake cataract of diabetes mellitus. कोई दिक्कत नहीं है इसमें. So this is a classical case. What is my diagnosis? Galactosemia, major or minor? Major, because not only cataract but also malabsorption symptoms are seen. So what should be the answer? Option A is phacoemulsification. Is it if it is a reversible cataract, do we need a phacoemulsification? Option B says wait and watch. अपने आप ठीक होगा क्या? तुम दूध पिलाते रहो, अपने आप ठीक होने वाला है क्या वो? No. Flax, बच्चे में तो any which ways नहीं करते. So what is the answer? Avoid dairy products. Any milk or milk containing or dairy products has to be avoided. No issues with this? This is the classical feature of. इसीलिए कभी-कभी ज्यादा दिमाग नहीं चलाना चाहिए. Next is, what is this? This is a classical snowflake cataract, and snowflake cataract is seen in a patient of diabetes 1 or 2, zyada common, because diabetes mellitus type 1 is more severe. ठीक है, तो याद रखना ये बात. It is due to collection of excess amount of sorbitol. Shabash. And it is also the most common cause of loss of vision in a patient of diabetes mellitus or diabetic retinopathy. In a patient of diabetes mellitus, diabetic retinopathy में it is the CME, cystoid macular edema. ठीक है, this is what, यही तो सोचा होगा ना कि ऐसा ही तो आएगा. So this is the oil drop cataract. Dr. Shivani doesn't make the paper. उनके images exact repeat होंगे वो, तो मैं बता रहा हूँ पहले ही. बस ना ही मैं बनाता हूँ तो मेरे भी exact repeat होंगे, वो नहीं है. तो थोड़ा लॉजिक लगाया करो कभी कभी इमेजेस में. गिव द होराइजन की एक ही टाइप, ऐसा ही नहीं होगा एग्जैक्टली. ठीक है, तो कभी कभी वो भी विकिपीडिया से निकालेगा, तो हमारे जैसे इमेजेस होंगे, बट हर बार वो विकिपीडिया से निकालेगा जरूरी नहीं है. ठीक है. This is what? This is the classical onion peel appearance. And this classical onion peel appearance which is there is seen in which condition of cataract? Shabash. It is the posterior polar cataract. And can we call the posterior polar cataract as the most dangerous cataract? Yes, the posterior polar cataract is known as the most dangerous cataract. Why? Maximum chances of rupture. Okay, posterior pole जो होता है lens का, it is the thinnest pole of the capsule. And इसीलिए अगर यहाँ cataract हो, there is maximum chances of rupture. अगर वो पूछे most visually disturbing cataract, the most common type and the most visually disturbing cataract, very good. It is the PSC, that is posterior subcapsular cataract. PSC, posterior subcapsular cataract. Most of the cataracts are of which type? PSC, posterior subcapsular cataract होते हैं most of them. ठीक है, no issues. And this is nothing but the क्या है? कचरा जमा हुआ है पेशेंट में. acute angle closure glaucoma था, क्या है ये? Very good. It is a case of glaucoma flecken. ठीक है. Question number 7 now. It says a patient with history of running nose, pain over the medial aspect of the eye. ठीक है, यहाँ पे दर्द है इसके. Presents with sudden onset high grade fever. Chemosis. Chemosis is nothing but swelling or edema of the conjunctiva. ठीक है. There is pulsatile proptosis. Okay, proptosis is what? Protrusion of the eyeball. And pulsatile है. क्यों? क्योंकि कौन धकेल रहा है आँख को आगे? Some vessel. Very good. Some vessel which is having pulsation. It is pushing the eyeball forward. This is what is your keyword. Pulsatile proptosis. Normal proptosis नहीं है, pulsatile है. That means some vessel is pushing it forward. With diplopia on lateral gaze. With congestion of optic disc. Congestion is nothing but redness of the optic disc is there. Which of the following is the most likely diagnosis? Important is Diplopia is what? Double vision on lateral gaze. Now important is, okay, when I'm looking laterally, which muscle is helping me? Lateral rectus muscle. And my lateral rectus muscle is supplied by which nerve? Sixth cranial nerve. That is your abducens nerve. And we know that in a patient of cavernous sinus thrombosis, the most common cranial nerve and the earliest cranial nerve which will be involved is the sixth cranial nerve, because it lies in the center of the cavernous sinus. Okay, and on the lateral aspect of the cavernous sinus, we have the third, fourth, and the fifth cranial nerves. So, अगर cavernous sinus का thrombosis हुआ है, there will be swelling of the cavernous sinus, and due to that, the earliest nerve which is going to be compressed is the sixth cranial nerve or the abducens nerve. So, this is the earliest as well as the most common cranial nerve to be, most common cranial nerve to be compressed. No issues with this, anybody? And later on, definitely there will be palsy of third, fourth, and fifth cranial nerve also. So, easily as the sixth cranial nerve is compressed, there will be palsy of which muscle? Lateral rectus muscle. Therefore, whenever I try to see laterally, this pencil will appear as true. That is, double vision on lateral gaze is seen. No issues with this, anybody? That's important. Which of the following is the most likely diagnosis now? It's very easy. Option C is cavernous sinus thrombosis. और क्या चाहिए तुम्हें? Okay, there is almost the protrusion of eyeball with vascular structures in it. Option A says acute ethmoidal sinusitis. Please tell me, in a case of ethmoidal sinusitis, will the patient have any features of sixth cranial nerve palsy? No, definitely. Okay, so that is more important that you have to remember. No pulsatile proptosis will be seen in the patient. Okay. Option B says orbital cellulitis. Orbital cellulitis means the patient is going to have periorbital swelling. The patient is going to have periorbital pain, periorbital swelling, periorbital redness. ये चीजें होंगी. यहाँ periorbital redness दिख रहा है क्या तुम्हें? नहीं, the eye is pushed forward, right? So that is important, as you can see over here. No periorbital redness, pain or swelling is seen. Option D says orbital apex syndrome. That is also not a feature. Orbital apex syndrome, there is no pulsatile proptosis which is seen. Question number 8. Okay, what is the diagnosis in the below given condition? It is which kind of a squint? Sabse pehle, there is, you can see there is a deviation of eye. The patient does not seem to be looking forward. Okay, there is deviation of eye. And we know that deviation of eye is known as a squint. Squint is also called as strabismus. Okay, squint is also known as the strabismus. And definitely, agar squint ya strabismus ki baat karu, to here, is the patient having any paralysis? It doesn't seem like that. So kya dikh raha hai? There is actually a supraorbital fold which is present, and due to that supraorbital fold which is there, definitely it appears as if the child is having a squint. But actually, is he having a squint? No, he is not. So therefore, it is actually a false squint. That is what is called as pseudo squint. इस supraorbital fold को क्या बोलते हो तुम? Epicanthic fold. So due to this epicanthic fold, if it appears as if the patient is having the squint, that is a case of pseudo squint. Paralytic squint is due to palsy of the extraocular muscles. Okay? It is due to palsy of the extraocular muscles. Okay? Due to nerve injuries. Important is, if both the eyes are looking upwards, that is, if the eye is looking upward, that is called as, क्या बोलते हैं इसको? Hypertropia. Then if the eye is looking downwards, what is that called as? That is called as hypotropia. If the eye is looking inside, what is that called as? Okay, so here you have it. If the eye is looking inside, as you can see, it is called as esotropia. And if the eye is looking outside, what is that called as? As you can see in this picture, it is called as exotropia. No issues with this, anybody? So please remember this. Okay? These are the various types of squint that you have to be aware of. Question number 9. It states a 60-year-old male gives history of cataract surgery 1 year back. He now complains of diminished vision which has progressed gradually. मतलब धीरे धीरे करके और खराब होती जा रही है उसकी vision. Okay, under slit lamp examination, the following findings are seen. What is the most likely cause of his loss of vision? Huh? So now important is definitely he gives a history of cataract surgery. After cataract surgery is having loss of vision. ठीक है? So definitely cataract surgery के बाद if the patient is having again loss of vision, it has to be some or the other complication related with cataract surgery. Which is the most common complication of cataract surgery? The most common complication of cataract surgery is PCO. What is PCO? Posterior capsular opacification. Also known as which cataract? Secondary cataract or an after cataract. Okay, so that is what is seen. Important is, this is the most common complication, but it occurs early or late? It usually occurs late. That is after 6 months of cataract surgery usually. Okay, and ये जो होता है, what is this? Bus. This is a complication after cataract surgery known as endophthalmitis. Now definitely itis is infection or inflammation. Endophthalmitis means infection or inflammation of the inner layers of your eyeball, that is retina and the uvea. Okay, and this endophthalmitis, you have to remember, it is the most common early complication of cataract surgery. It is the most common early complication. Within 3 months it is going to happen. Now endophthalmitis can be of two types. It can be either early or late endophthalmitis. Early endophthalmitis का most common cause बताओ. It is staph epidermidis, known as cons. That is coagulase negative staphylococcus. Okay, coagulase negative staphylococcus. Late का the most common cause is P. acne. That is Propionibacterium acne. ठीक है, ये भी full form नहीं रटा हुआ है ना, ये भी shortcut में जान के. So important is Propionibacterium acne. Important is बच्चों, if the patient has endophthalmitis, definitely it is a severe infection and inflammation. Therefore, the patient will have a lot of pain. So there will be painful loss of vision in the patient. Apart from that, can you see there is a lot of redness which is seen? There's a lot of congestion of the conjunctiva which is seen. Then there is also pus formation in the anterior chamber, and that is what is called as hypopyon which is seen. Okay? And as you can see, the cornea appears to be hazy, because if there is inflammation, definitely there is going to be edema. जिसकी वजह से definitely corneal edema causes haziness and blurring of vision as well. कोई दिक्कत नहीं है. So that is what is the case of endophthalmitis. Treatment बताओ. So definitely the first line treatment is always going to be intravitreal antibiotics. ठीक है, क्योंकि हमें अंदर तक जाना है ना भाई, in the deeper layers, inner layers. So intravitreal antibiotics. If that fails, then direct. पहले तो steroids try करोगे ना भाई. And if that fails, then I'll go for PPV, pars plana vitrectomy. जितना भी inflamed vitreous है उसी को निकाल दो पूरा. ठीक है, that is pars plana vitrectomy. No issues with this anybody? That is what is this. And PCO जो होता है, posterior capsular opacification, as I told you, it more commonly occurs after 6 months of cataract surgery. And here, will there be painful or painless loss of vision? Painless. Gradual or sudden? There will be a gradual painless loss of vision. भाई वापस cataract बन रहा है ना, तो वो धीरे धीरे बनेगा. So there is a gradual painless loss of vision in the patient. ठीक है, अपने patient में क्या है? There is diminution of vision. Painful or painless? They have not mentioned about any pain, so that means we will consider it as painless loss of vision, and that too which has progressed gradually. Okay, that means धीरे धीरे चल रही है. Slit lamp examination shows which finding? ये तो confirmatory था. What is seen on this? You can see small dots. These are nothing but the pearls. And what are these pearls called as? So your PCO can be of two types. दो तरीके का हो सकता है. एक तो dots दिख सकते हैं तुम्हें, या rings दिख सकती है opacification की. ठीक है? This is the most common type, that is known as the Elshning pearls. These are the most common type known as the Elshning pearls. ठीक है? Whereas अगर ये भी दिख सकता है, what is this? Very good. This is classically your Sommering rings. These are what are your Sommering rings. No issues with this anybody? That has to be remembered. Okay. Now please tell me what has to be the answer. Option B, that is posterior capsular opacification. Option A says Irwin-Gas syndrome. Please remember, Irwin-Gas syndrome is not a complication which is associated with painless and gradual loss of vision. Okay. Next option says option C, UGS syndrome. That is uveitis, glaucoma and hyphema syndrome. So obviously अगर uveitis हो रहा है, so definitely the patient will have pain. And second, hyphema है, so there should be blood in the anterior chamber which is not seen on the slit lamp examination. Endophthalmitis, painful loss of vision, and that too early in the course, not after 6 months. ठीक है? So no issues with this anybody? Treatment क्या करते हो इसके लिए? क्या एनडी आंख से क्या करते हो? एनडी आंख लेजर कैप्सुलोटमी, क्योंकि कैप्सूल ओपेसिफाई हो गई है, सो मेक अ होल इन द कैप्सूल इटसेल्फ विद द हेल्प ऑफ दैट एनडी आंख लेजर. कोई दिक्कत नहीं है. Question number 10. It states a 58-year-old patient was suffering from visual field defects as shown in the below given image. What is the likely diagnosis? सबसे पहले डेफिनेटली विजुअल फील्ड डिफेक्ट्स दिख रहे हैं. ये इन्वेस्टिगेशन है कौन सा? Very good. This is a perimetry. Please remember, visual field examination or assessment is done by an investigation known as perimetry, and this was a previous year exam question as well. ठीक है? Perimetry से करते हो. And perimetry पे definitely याद रखना, what does perimetry shows? It shows you the visual field. तुम कितनी चीज देख पा रहे हो. That is what is assessed with perimetry. You are given a lot of stimulus, और हर बार तुम्हें जो चीज दिखाई देती है, you are going to press a button that you have. Okay, and that is going to record your perimetric examination. तुम्हें कहां पे नहीं दिखाई देगा? There in the visual field there will be one point where you will not be able to see, and what is that point called as? Blind spot. What does this blind spot corresponds to? क्या होता है इस जगह पे? Optic disc. What is optic disc? Visible part of the optic nerve is what is known as the optic disc. Does it contain any rods and cones? No. As it does not have any rods and cones, will there be image formation at the level of optic disc? No. और अगर image formation नहीं होता तो तुम्हें blind spot की जगह पे, optic disc की जगह पे कुछ दिखेगा क्या? कुछ नहीं. Therefore, there is a blind spot at the level of the optic disc. Now, if I talk about a patient of glaucoma, definitely, मैंने क्या बोला था? Glaucoma के patient में तीन important features होते हैं. First, the intraocular pressure of the patient should be high. Second, there should be damage to the optic nerve, and third important, there should be visual field defects in the patient. Now if I talk about the visual field defects अभी की है, ये ठीक है? Visual field defects में क्या क्या दिखेगा? सबसे पहला first change is what? जो मेरी पूरी विजुअल फील्ड है इतना मुझे नजर आ रहा है, बट कितना अब क्या होगा? कम हो जाएगी. There will be constriction of my visual field. थोड़ी चीजें मुझे कम दिखाई देगी, बट ये पेशेंट को पता भी चलेगा क्या? No. Therefore, this first change which is there, that is constriction of visual field, it goes unnoticed. Patient तुम्हारे पास आता ही नहीं उस condition में. ठीक है? So please remember the first change. If they ask you, answer has to be constriction of the visual field. Okay? That is important. But अगर वो बोलते हैं, what is the first change noticed? Then what is your answer? Very good. If they ask you what is the first change noticed, it is this one. That is definitely, for example, this is my visual field. मुझे for example वो पंखा नहीं दिखाई दे रहा है. That means definitely away from the center, I am not able to see one thing, and that is what is called as a scotoma. ठीक है? So this is what is a paracentral, मतलब around the center. किस shape का? Wing shaped का क्या बनता है? Scotoma. Scotoma is nothing but blind spot itself, but not the normal one. Abnormal blind spot is called as a scotoma. So paracentral wing shaped scotoma is the first change which is noticed. It is the first change which is noticed. Now this paracentral wing shaped scotoma, okay, will further progress to what? It is going to combine with the blind spot. वो blind spot के साथ combine कर जाएगा, and now a larger scotoma will be formed. इस scotoma को क्या बोलते हैं? किस shape का दिख रहा है? Half moon shape. That is called as sickle shaped scotoma, also known as a Seidl's scotoma. It is known as a half moon shaped Seidl's or a sickle shaped scotoma. Then this is going to progress further into an arc-like scotoma. And what is this arc-like scotoma called as? I can either call it as the arcuate scotoma, or it is known as the germ scotoma. This is a germ scotoma. Okay? So this is what is seen. A arc-like scotoma is a germ scotoma. Next important, यहाँ कितनी आंख दिख रही है? दो. तो अभी और definitely visual field is getting affected, and therefore there is a double arcuate, or I can call it as the ring-like scotoma. Either there is a double arcuate or a ring-like scotoma. No issues with this. And lastly, definitely, क्या हो जाएगा, क्या बच जाएगी मेरी एक? I'll have only tunnel vision. Who is responsible for tunnel vision? Which part of the retina? Macula. That is the central part. ठीक है, अब तक macula को damage नहीं हुआ है. But then in the later part, the macula will also be damaged. And now only what is left? Only a small temporal island is left. बस एक temporal island बच जाएगा. And finally then will be complete blindness. ठीक है. So that are what are the changes which are seen on the visual field in a patient of glaucoma. And this is important. ठीक है, glaucoma, cataract, uveitis are the and conjunctivitis are the four most important conditions of ophthalmology. ठीक है, अगर तुम बाकी चीजें पढ़ रहे हो और ये नहीं पढ़ रहे हो, आधी चीजें छोड़ रहे हो, सीआरवीओ और सीआरएओ, झटका बैठेगा एक जिसमें सीआरवीओ और सीआरएओ नहीं आएगा एग्जाम में. एंड दैट आर माय वर्ड्स, मार्क इट. सो इंपॉर्टेंट इज, याद रखना, क्योंकि ऐसे झटके उन्होंने बाकी सब्जेक्ट्स में दिए हैं. ईएनटी दिस टाइम इट वाज अनकॉमन. सम क्वेश्चंस वर रियली रियली अनकॉमन फ्रॉम ईएनटी दिस टाइम. ठीक है, तो इसीलिए बोलता हूं कि बी रेडी फॉर व्हाटएवर कम्स योर वे. उस उधर जाके रोना नहीं होता है कि यार ये तो पढ़ा ही नहीं, क्यों नहीं पढ़ा, नोट्स में था ना. जो नोट्स में नहीं वो छोड़ो, जो नोट्स में था, मैम ने पढ़ाया है, नहीं समझ में आया, पूछो, मैम से पूछो, हमसे पूछो, हम बैठे हैं. बट डोंट स्किप इट डायरेक्टली. नहीं समझ में आ रहा, उड़ा दिया, टॉपिक ही उड़ा दिया. दैट शुड नॉट हैपन. जो अनकॉमन है वो हम खुद बोल देंगे, हाँ यार छोड़ो ये, इसका कोई दिक्कत नहीं है, बट आस्क इट आउट फर्स्ट. ठीक है. This is what? Which kind of scotoma? Arc-like scotoma. Therefore, it can be called as arcuate scotoma. Or another name for this is a germ scotoma. So answer is option B for this. ठीक है. Question number 11. The optical instrument shown in the image is used for the evaluation of. What is this? बात करने के लिए थोड़ी बोला था मैंने, आंसर देने के लिए बोला था. प्लासिडो डिस्क. एंड व्हाट इज द यूज ऑफ प्लासिडो डिस्क? तो केराटोमीटर क्या बताता है फिर? आंसर इज ऑप्शन ए, that is corneal topography. It is going to tell you about the corneal topography. ठीक है, the shape of the cornea. Very good. So topo is nothing but the shape of the cornea. So shape of the cornea is assessed with the help of the placido disc usually. Corneal curvature जो होता है, corneal curvature is assessed with the help of this investigation known as keratometry. So definitely it is going to tell you about the corneal curvature. What is this? This is nothing else but pachymetry. And pachymetry is going to tell you about the corneal thickness. And corneal sensations are assessed with the help of, उसमें definitely एक small needle like instrument होगी which is actually touching your cornea. So you are actually checking for corneal sensations, and that is done by which examination? Esthesiometry. So corneal sensations are checked by esthesiometry. Esthesio का मतलब sensations होता है, metry का मतलब measurement होता है. ठीक है, that is important. Next important is this. What is this? This is a slit lamp biomicroscope. And this slit lamp biomicroscope can tell you about pathologies of the anterior segment or posterior segment. Shabash. It can tell you about the pathologies of anterior as well as posterior segment pathologies. ठीक है, posterior segment pathologies के further confirmation के लिए I can go for ultrasound B scan also. Ultrasound A scan is used for measurement of axial length of the eyeball. How much is the axial length of eyeball in adult? 24 millimeters. In a newborn eye, 16.5 millimeters. ठीक है, newborn eye, as it is small, the rays of the light will fall in front of the retina or behind the retina? Behind the retina. And therefore it is a hypermetropic. So a newborn is hypermetropic by how many diopters? +2 to +3 diopters. And therefore जैसे बच्चे की ग्रोथ होगी तो क्या चेंज दिखेगा? पेशेंट बच्चा हाइपरमेट्रोपिया से कहाँ रहा होगा? बच्चा is having +2 to +3 diopters of hypermetropia. ठीक है, newborn as the eyeball is smaller. तो हाइपरमेट्रोपिया से कहाँ रहा होगा बच्चा? इमेट्रोपिया पे, ठीक है। सो डेफिनेटली एज द चाइल्ड इज कमिंग फ्रॉम हाइपरमेट्रोपिया टू इमेट्रोपिया, किसकी तरफ जा रहा है हम बोल सकते हैं मायोपिया की तरफ, बट मायोपिया नहीं होता, बट दिस इज व्हाट इज कॉल्ड एज myopic shift, and this has been a previous year question. What is the change which is seen in a newborn eye? Answer is myopic shift is seen. तो उन्होंने बोला था if you want to recommend or if you want to prescribe lenses for a newborn child, what you have to keep in mind? We have to keep in mind the myopic shift which is going to happen in the newborn eye. ठीक है, चलो coming back. What is this बच्चों? This is a stenopic slit, and this stenopic slit is used to differentiate the colored halos between congenital cataract and glaucoma. This is what? This is a Maddox rod usually. Okay, it is going to help you in diagnosing squint. Okay, this is what? Tono pen. Tono pen is a handheld portable tonometer which is going to measure the intraocular pressure, and it is going to show the directly. It is going to show the value directly on the meter itself. Then what is this? Which type of tonometer is this? This is a Shyot's indentation tonometer. ये कॉर्निया में गड्ढा करके मेजर करता है प्रेशर. Therefore, it is indentation tonometer. This is a Shyot's indentation tonometer, and this is the gold standard tonometer. What is this? So this is the Goldman's applanation tonometer. Applanation मतलब it flattens up the cornea and then measures the intraocular pressure usually. This is the Goldman's applanation tonometer. No issues with this, anybody? That is important to be remembered. ठीक है? Goldman's की image already आ चुकी है एग्जाम में. Maddox rod has been asked in NEET PG examination. ठीक है? And what is the purpose of retinoscopy बच्चों? तो specular microscopy क्या करता है फिर? Very good. Retinoscopy is used for refractive errors. भले उसके नाम में retinoscopy है, it is not used for retinal examination. You have to remember, retinal examination के लिए the examination is known as fundoscopy, and retinoscopy is used for the examination or diagnosis of refractive error. Myopia या hypermetropia पता लगाना हो तो one arm distance पे retinoscopy करी जाती है patient में. No issues with this, anybody? That's important. Question number 12. We have a malnourished child from a poor socioeconomic status residing in overcrowded and dirty areas, presents with a nodule around the limbus with hyperemia, that is redness of the surrounding conjunctiva in his left eye. He also observed to have axillary and cervical lymphadenopathy. Which of the following is the most likely diagnosis? So definitely, as they are saying, malnourished child, poor socioeconomic status, residing in an overcrowded and dirty area. Okay, this child is definitely having a nodule, and this nodule which is there, it is present on the conjunctiva of the patient definitely, and you can see there is redness of the conjunctiva also. That this means it is a case of conjunctivitis. See, option option A says flight tenular conjunctivitis. Option B says foreign body granuloma. Is there any history of foreign body in the eye? No. So rule out foreign body granuloma. We are left, and option D says episcleritis. Is there any inflammation of the sclera? No. It is actually inflammation of the conjunctiva which is there, and there is nodule over the conjunctiva. Along with this, definitely, ठीक है, यहाँ पे उन्होंने clearly mention किया है, there is hyperemia of the conjunctiva. So it cannot be a case of scleritis. It is a case of conjunctivitis. He also observed that the patient has axillary and cervical lymphadenopathy. So lymphadenopathy in a poor child, malnourished child, is a case of shabash TB, and definitely TB के साथ ऐसा कौन सा conjunctivitis है जो associated है? It is option A, flight tenular conjunctivitis, and this nodule which is there on the conjunctiva is what is called as the flight 10 usually. This is known as a flight 10, therefore. And this flight tenular conjunctivitis, most common cause is TB or what? Very good. The most common cause is not TB. The most common cause is staph, or yes, the second most common cause is TB usually. कोई दिक्कत नहीं है इसमें. That has to be remembered. So this lymphadenopathy was another hint that was given to you. कोई दिक्कत नहीं है. So please be aware of this. Vernal keratoconjunctivitis. It would have been a young boy, ठीक है. But important was there should have been history of चलो summer season. Apart from that, most important symptom, that is itching. Okay. But important is, apart from that, in a case of vernal keratoconjunctivitis, the most characteristic features are cobblestone papillae. It is a papillary conjunctivitis. So the most characteristic feature are the papillae. Usually you have to remember that. ठीक है? तो वो papillae के बारे में तो कोई mention ही नहीं था. It was a nodule which is not seen in a case of VKC. This is what. This looks like a flight 10, but is there an inflammation of the conjunctiva? No. So if there is no inflammation of conjunctiva, only a nodule which is present, yellow colored nodule. This is actually due to deposition of lipid which is there. And this is usually known as pinguicula. This is what is known as pinguicula. Okay? What is this? Definitely a wing-shaped fold encroaching the cornea. This is a classical case of. So the wing-shaped fold of conjunctiva which grows over the cornea is known as pterygium. What is this? Recent NEET PG question, 2023. Very good. It is a case of lipodermoid. Okay? So yaad rakh lo, dermoid cyst, we know usually it occurs at the level of the outer or the lateral canthus of the eye. Jo bachcha aata hai surgery se. Okay? But this time they played in NEET PG examination and they gave definitely a dermoid which was present on the eyelid, and it was not only a dermoid cyst. Option mein dermoid cyst bhi tha, but as it was yellow in color, there was not only deposition of dermal elements, there was also lipid deposition in it. So therefore the diagnosis has to be lipodermoid in it. ठीक है? So that is important. नीट पीजी के क्वेश्चन तो मैं लगते होंगे कि चलो इनको तो वन लाइनर पूछ रहे, इतना आसान पूछ लिया. The options are very confusing and the options are very close. If you feel that definitely नीट पीजी questions are easy, they are not. The options are very close. जिसने 4 टॉपिक पढ़े उसको तो पता होगा कि हाँ अच्छा यही आता, यही मतलब पढ़ा तो इतना ही है तो यही आंसर होगा. जिसने और 10 टॉपिक पढ़ रखे होंगे उसको सब में कंफ्यूजन होगा. ठीक है? सो दैट इज द प्रॉब्लम इन नीट पीजी. व्हाट इज दिस? डेफिनेटली दिस इज व्हाट इज अ chalazion. This is what is a chalazion. Chalazion is also known as chalazion is nothing but a meibomian cyst, or we can even call it as a tarsal cyst because it is present on the tarsal conjunctiva. Important is definitely, bacho, please remember, this meibomian cyst is a chronic or an acute inflammation. Chronic infection and inflammation of the meibomian glands. Definitely. Is it painful or painless? It is a painless infection. What is a painful infection called as? Meibomian gland का होता है वो? तो hordeolum externum. Okay, hordeolum internum. Hordeolum externum is tie, which is a feature of acute inflammation of the Z's and the mole glands. ठीक है? So that is important to be remembered. इसको निकालने के लिए what is the treatment बच्चों? Excision with curettage. ठीक है? That is the treatment of choice for a meibomian cyst or a chalazion, which is a previous year question of NEET PG. Important is तुम्हारे एग्जाम में image आई थी for the instrument that we use for the removal of chalazion, and that is what is a chalazion clamp. थोड़ा सा ही दिखता है, मान जाओ. ठीक है? So that is what is seen. Question number 13 now. A person who has been a contact lens user now complains of redness, itching and pain. He comes to the OPD and examination reveals the below given feature. What is the likely diagnosis? So patient is having redness, itching as well as pain is there. That means they are definitely talking about some infection or inflammation. ठीक है? OPD में आता है. What is the classical feature? क्या दिख रहा है इसमें? हैं? यहाँ क्या दिख रहा है? What are these? Definitely, these are nothing but the follicles of papillae. Red in color, na? So they are usually red color papillae usually which are seen. Okay? Follicles are usually white in color and they are larger also. So these are papillae which are seen. Now papillae on the upper palpebral conjunctiva are seen in two important conditions. One is definitely VKC, vernal keratoconjunctivitis, and second is GPC, that is giant papillary conjunctivitis. अब इसको giant papillary क्यों बोला गया? Because the follicles are larger in size, more than 1 millimeter. Whereas if the follicles are very small in size, less than 1 millimeter, they are called as VKC 1 to 3 millimeters is the range, so you can manage it with that. ठीक है, important is now important is याद रख लो VKC is more common in young patients, usually young boys. It is more common during spring season. And what is the main complaint? Itching. Is there any history of contact lens usage over here? VKC. And if I talk about giant papillary conjunctivitis, important. Giant papillary conjunctivitis is due to which kind of trauma to the eye? Mechanical trauma to the eye. Now, mechanical trauma mein bache definitely there can be two types of history. Either the patient की असली आंख निकाल दी गई और कौन सी आंख लगा दी है? नकली आंख लगा दिया. That is a prosthetic eye. Or the patient has been using contact lens for a very long duration of time. Contact lens user है. Now in both the condition, ये जो prosthetic eye होती है, metallic eye होती है, or this contact lens user, जब भी वो आंख बंद करेगा, his conjunctiva, his upper palpebral conjunctiva, is it frictioning over this metal or over this contact lens? Yes. And that is the reason why the patient develops this conjunctivitis known as giant papillary conjunctivitis, which occurs due to the mechanical trauma to the conjunctiva, which causes the inflammation. ठीक है, that is important. Important is यहाँ पे papillae बड़े हैं छोटे हैं? बड़े हैं. They are more, they are larger in size usually. The giant papillae which are seen, and there is also a history of mechanical trauma. ठीक है, so therefore this has to be a case of GPC. That is answer is option D, giant papillary conjunctivitis. This has been a previous year question of NEET PG 2021. ठीक है? So option A says VKC. याद रख लो VKC में papillae जरूर दिखते हैं, but they are very very small, and there are also a lot of features which are seen in a patient of VKC which are not seen over here. Option B says trachoma. Trachoma is a papillary or a follicular conjunctivitis. So the more characteristic feature of trachoma is a follicle, not a papillae. Okay, and follicular conjunctivitis is not there. It is a papilla which is seen. What is this, बच्चों? सरकारी question exam का. That is a dendritic. This is a dendritic keratitis or a dendritic ulcer. ये जो corneal ulcer बना है, it is actually having these finger-like projections which are known as the dendrites. ठीक है? Important, dendritic keratitis is nothing but inflammation of the cornea. So that is dendritic keratitis. Is bacterial, fungal, viral? So it is viral, and the most common cause is 1 or 2. It is HSV 1, above waist 1, below waist 2. Herpes simplex virus type 1. No issues with this, anybody? And the second important question which was asked, what happens to the corneal sensation? Increased, normal, or decreased? So it is the only corneal ulcer where the corneal sensations will be decreased predominantly. Okay? So there will be decreased corneal sensation. That was the question. Image was given and they asked you which among the following features is seen. Answer was decreased corneal sensations are seen. What is the drug of choice for this dendritic ulcer? Definitely it is the acyclovir drops which are given to the patient. How much percent? 3% acyclovir drops are given to the patient. Important is ये जो अल्सर है डेंड्राइटिक अल्सर डेफिनेटली ये ग्रीन कलर का क्यों दिख रहा है? ड्यू टू द यूज ऑफ द फ्लोरोसिन डाई दैट वी आर यूज. ठीक है, चमक रहा है वो इसलिए. व्हाट इज दिस बच्चों? हैं? This is a case of a shield ulcer. So this is nothing but a shield ulcer over the cornea which is seen in a patient of VKC, vernal keratoconjunctivitis. What are these? A small papillae or large papillae? And therefore these are known as, these are classically the cobblestone papillae, which are a most characteristic feature of VKC, that is vernal keratoconjunctivitis. And what are these? Eosinophilic accumulation on the upper limbus. These are classically known as your Horner Tranta spots. These are eosinophilic accumulation on the upper limbus, known as Horner Tranta spots. This is also a classical feature of VKC. Mnemonic अगर याद रखना है, वीडियो से VKC, ओमकार से the drug of choice for VKC. Answer is olopatadine. has the, say definitely the Horner Tranta spots. P say definitely the papillae. Which one? The cobblestone papillae. S say definitely which ulcer? The shield ulcer. And definitely M say kya hai? So the Maxwell-Leon sign. What is the Maxwell-Leon sign? The thick ropey discharge. Okay, so that is the important feature that you have to be aware of. VKC is also known as spring cataract, which is commonly seen in summer. So this is a misnomer. कोई दिक्कत नहीं है इसमें. Antihistaminics can also be given, but yeah, VKC is which type of hypersensitivity? Type 1, because it is an allergic one due to pollen grains. No issues with this, anybody? Question number 14 now. An elderly diabetic male patient presents with complaints of paresthesia. What is paresthesia? Decreased sensations. Next is numbness, which has progressed to hemiplegia on the left side. Hemiplegia is complete paralysis of half of the body. Hemiplegia on the left side. He also started complaining of some ocular symptoms. So diagnosis of Weber syndrome has been made. Which among the following feature will not be suggestive of his ocular condition? What is Weber syndrome? Chalo. I'll give you this advantage. Medicine new hai na? So Weber syndrome is a feature of CVA or stroke. Important is Weber syndrome mein there is a classical feature where the patient has contralateral hemiplegia plus which cranial nerve palsy? Plus the patient is having a third cranial nerve palsy. A third cranial nerve is which one? Oculomotor nerve. Now, definitely we are quite aware, bacho, that all your extraocular muscles, all the extraocular muscles are supplied by the third cranial nerve or the oculomotor nerve, except LR6, SO4, that is lateral rectus by the sixth cranial nerve known as abducens nerve, and superior oblique by the fourth cranial nerve known as trochlear nerve. कोई दिक्कत नहीं है. Now here as the Weber syndrome बोला उन्होंने, so it is a case of third cranial nerve palsy or oculomotor nerve palsy. So now please tell me oculomotor nerve palsy में क्या क्या होगा? Definitely the levator palpebrae superioris muscle will be paralyzed. And what is the function of this LPS muscle? Elevation of the eyelid. ये आँख खोलने में मदद करती है. But if this is paralyzed, the patient will have drooping of eyelid, and drooping of eyelid is known as ptosis. So a patient is definitely going to have ptosis. Okay, so ये होगा. Next important is the patient's superior rectus muscle will be paralyzed. As the superior rectus is paralyzed, what is the primary function of superior rectus? Elevation. ठीक है, so definitely elevation will be affected. तो आँख कैसी होगी? Downwards, that is depression होगा आँख का. ठीक है. Then next is your medial rectus. Your medial rectus muscle is also supplied by third nerve, so it will be paralyzed. Medial rectus का काम क्या होता है? To bring the eye medially. That is adduction. अगर adduction नहीं होगा तो आँख क्या क्या हो जाएगा? Abduction. That means the eye would be outwards. ठीक है. तो definitely depression हो रहा है मतलब down eye, and abduction हो रहा है मतलब out eye है. ठीक है. And third important one, this was about the extraocular muscle. Now talking about the intraocular muscle. One intraocular muscle is supplied by the third cranial nerve. There are two pupillary muscle. One is called as dilator pupillae and second is called as sphincter pupillae. Which one is supplied by the third cranial nerve? So sphincter pupillae is supplied by the third cranial nerve. If the sphincter pupillae is paralyzed, definitely will the patient be able to will the patient be able to constrict the eyeballs? No. That is the reason why. What is going to happen? Okay, dilator pupillae will be supplied by sympathetic nerve, definitely. Okay, so therefore when there is Horner syndrome in a patient, okay, due to sympathetic nerve injury, what is going to happen? There will be palsy of the dilator pupillae muscle, and therefore the eye will be constricted or it will be myotic. As there is third cranial nerve palsy, the patient will have definitely palsy of the superior sphincter pupillae muscle, and that is the reason why there will be mydriasis. कोई दिक्कत नहीं है इसमें. Now, so definitely, please, option A says normal pupillary reflex. Will there be normal pupillary reflex? No. If the sphincter pupillae muscle is paralyzed, okay, will there normal pupillary reflex क्या होता है बच्चों? When we are going to flash torch inside the patient's eye, his pupil should undergo constriction. क्या होना चाहिए? Myosis, definitely, light की वजह से. But इस patient में sphincter pupil काम कर रही है क्या? नहीं कर रही है. So even if you flash light or torch in his patient's eyes, will there be constriction? No, it will be always dilated. So is it a normal pupillary reflex or an abnormal pupillary reflex? Abnormal. So is normal pupillary reflex seen? No. Option B says ptosis. Yes, it is seen. Option C says outward and downward rolling pupil. Yes, it is seen. Impaired pupillary reflex. Yes. The answer for this question, which is not seen, is option A. Normal pupillary reflex is not or never seen in a case of third cranial nerve palsy. So this was the trick that they played in this question. बकवास करी थी बिल्कुल पहले in the question sometimes, just to trick you, just to make you more anxious in the examination. कभी कभी पूरा एक question important भी नहीं होता है, उनको बस इतना ही पूछना था कि oculomotor nerve palsy में क्या होता है. But they tricked you either with the language or with the length of the question. ठीक है? So you have to be aware of both of these things. Okay, so that's more important. And most important is if you keep on running out ना कि ऐसा तो आता ही नहीं है, ऐसा तो एक बार आया था, तो let me tell you भाई, ना वो तुम्हारा जमाइए ना मेरा जमाइए. काहे सोचेगा तुम्हारी? फालतू में ये उम्मीद लगा के बैठे हो तुम्हारे लिए पेपर आसान बनाएगा, कभी नहीं बनाएगा. एक्सपेक्ट करके चलो वो कभी नहीं बनाने वाला पेपर हार्ड, पेपर आसान. हम डेफिनेटली कैसा भी बनाए, वी आर रेडी टू फेस द एग्जामिनेशन. दैट्स इट. अपने आप को ऐसे तरह से तैयार करेंगे, वो कैसा भी पेपर बनाए, वी आर रेडी टू फेस द एग्जामिनेशन. बाकी डेफिनेटली जितनी मेहनत कर सकते हो उतनी कर सकते हो, बाकी तो लक पे ही होगा. थोड़ा बहुत तो डेफिनेटली लक पे रोल होता है, बट दैट डज नॉट मीन डेफिनेटली यू विल अभी से जो करेगा वो होगा, देखा जाएगा, मैंने तो पढ़ लिया. तो दैट शुड नॉट हैपन. ठीक है? सो दैट्स मोर इंपॉर्टेंट. व्हाट इज दिस बच्चों? The patient is trying to look in this direction. What is this? He is trying to look in the left side. Definitely यहाँ पे eye हो रही है क्या left side में? Yes. But ये वाली आंख जा रही है क्या left side में बच्चों? नहीं जा रही. अब क्यों नहीं जा रही? Because the lateral rectus muscle on this side is not working and the lateral rectus muscle is paralyzed. It is supplied by which nerve? So यहाँ पे कौन सी nerve की palsy है? Sixth cranial nerve, that is abducens nerve की palsy. Therefore, as the patient's lateral rectus muscle is not working, patient is not able to perform the abduction. ठीक है? Patient क्या नहीं कर पा रहा? Abduction नहीं कर पा रहा, इसलिए वो laterally नहीं देख पा रहा. तो अगर उसको laterally देखना होगा, वो क्या करेगा? पूरी की पूरी मुंडी घुमा देगा. So therefore the patient turns his head towards the affected side. जिस तरफ डैमेज है उस तरफ वो पूरा सर घुमा के देखेगा, because he cannot cause abduction. ठीक है? Turns head towards the affected side. Turns head towards affected side. No issues with this, anybody? Next important is this. क्या दिख रहा है? This is a classical ptosis and down and out eye. So that is nothing but a case of third cranial nerve palsy. What is this? In this condition, what are you able to do? Usko बीच में देखना था. Okay, she wanted to look in the middle. But is she able to look in the middle? No. Middle में देखना है तो क्या करना पड़ता है? दोनों eyeballs को inward turn करना पड़ता है. Inward turn is nothing but क्या बोलते हैं उसको? Intorsion. And intorsion is done by anybody. All superiors are intorters. So mainly it is done by superior oblique muscle. It is a primary intorter. तो यहाँ पे किस muscle की palsy है? Superior oblique muscle की palsy. And it is supplied by which cranial nerve? Fourth cranial nerve. Therefore, the patient is having trochlear or fourth cranial nerve palsy because there is loss of intorsion in the patient. यहाँ पे intorsion नहीं कर पा रही ना वो. That is the reason. ठीक है? Important is अगर उसको इंटॉर्जन करना है, ऐसे देखना है फॉर एग्जांपल, एंड शी इज नॉट एबल टू परफॉर्म इंटॉर्जन, तो वो क्या करेगी? she'll turn her head towards the opposite shoulder. Okay, she'll turn her head towards the opposite shoulder. For example, मुझे बीच में देखना है, I'm not able to see, तो मैं क्या करूंगा? I'll see like this. ठीक है? I'll turn my head towards my opposite shoulder. अगर इस साइड में लीजिए ना तो मैं इस तरफ मुंडी घुमा दूंगा. Got it? So that is what is seen. Turns head towards the opposite shoulder. Turns head towards the opposite shoulder. What are the mnemonics given by ma'am? Revise करो एक बार. Sin. What is sin? All superiors are intorters. All superiors are intorters. Then what is rad? All recti are adductors. Next, soabid. What is soabid? Superior oblique is responsible for AB, that is abduction. I for intorsion and D for depression. Okay, but this wala mnemonic does not apply for medial rectus and lateral rectus. That has to be remembered. कोई दिक्कत नहीं है इसमें. So that's important. This is the easiest way that you can remember these things till date. Okay. Question number 15. A 35-year-old commercial sex worker presented to the OPD with pain, floaters, blurry vision, and she is having neurological abnormality also. She gives history of a painless vulvar ulcer and a painless rash on palms and soles few years ago. Which of the following is true? पहले तो ये patient किससे diagnosed हुई है? Painless vulvar ulcer or painless genital ulcer with painless lymphadenopathy is a classical case of syphilis in a patient due to Treponema pallidum. Then along with that is a case of primary syphilis. ठीक है, and ये painless ulcer जो बनता है that is called as a chancre. ठीक है, शंकर के लिए सब कुछ painless होता है. Next important is painless rash on the palms and soles. That is what is called as. अरे क्या होता है भाई? Condyloma lata, which is a feature of secondary syphilis. Palms and soles पे brown color के spots which are painless in nature. ठीक है, so that is the case of syphilis, and definitely this patient has progressed now to ocular and neurosyphilis क्योंकि दोनों के features दे रहे हैं. So definitely this is a patient of syphilis which has progressed into complication. Ocular and neurosyphilis है. So definitely as she is having ocular syphilis, she is having pain, floaters, and blurry vision as well. Now, what is seen in a patient of syphilis? In a patient of syphilis, definitely, we are able to see which kind of pupil? Argyll-Robertson pupil, ARP. What is the feature of Argyll-Robertson pupil, bachcho? What is seen? Option A says normal light reflex and accommodation reflex is lost. Is it true? No. Option B says absent light reflex and accommodation reflex is normal. Yes. So that is what is your answer. Important is क्या होता है? What is a light reflex, बच्चों? Light reflex, as I've told you now, that is nothing but your pupillary reflex itself. जब तुम definitely see when you flash light, what should happen? The pupil should constrict. That is, they should undergo meiosis. This is a normal pupillary reflex or a normal light reflex. Okay, but क्या होगा इस patient में definitely? When you flash the light, definitely, what is happening? The pupil should undergo constriction, but यहाँ क्या हो रहा है उल्टा ही? The pupils are undergoing dilatation, definitely. Okay, so that is what is seen. That is an abnormal pupillary reflex which is there. Okay, and important is definitely what is going to happen. Accommodation reflex जो होता है वो किसके मदद से होता है? Ciliary muscles. Okay, so the ciliary muscles or the ciliary nerves are never involved in a patient of syphilis. That you have to remember. Therefore, there will not be any problem in the accommodation of the patient. Okay, there will be problem with the light reflex in the patient. So here the patient's the light reflex is going to be absent and the accommodation reflex is going to be normal. No issues with this, anybody? Question number 16. Oh God. Question number 16 says an 82-year-old woman presents with sudden loss of vision in her left eye. On further questioning, she complains of a left-sided headache over the past few weeks, associated with tenderness of her head when she brushes her hair. क्या बोलते हैं इस साइन को? इस साइन को क्या बोलते हैं? Tenderness. Tenderness is what? Pain. So she is having pain in the head when she is brushing her hair. This is what is classically called as the Lermite sign usually. ठीक है? This is what is known as the Lermite sign. Electrical current जैसा feeling आता है. ठीक है? On examination, her vision is reduced to counting fingers in the left eye. A left relative afferent pupillary defect is present. मतलब normally when the light is flashed, pupils constrict की जगह क्या हो रहा है? Dilate हो रहा है. And that is what is called as RAPD. That is relative afferent pupillary defect. And that is what is known as which kind of a pupil? Marcus gun pupil. That is the classical Marcus gun pupil. And अगर pupil react ही नहीं करते बिल्कुल, that is what is a total afferent pupillary defect. And total afferent pupillary defect is seen in which condition? It is known as the amyurotic pupil. That is seen in which condition, बच्चों? Complete damage of the optic nerve. So optic nerve जब completely damage हो जाती है, that is what is known as, that is what is causing total afferent pupillary defect. Sorry. Normally ये देखो important क्या है, अगर तुमने आंख में light flash करी, ठीक है, if you have flash light in the patient's eye, definitely कौन सी nerve stimulate हो जाएगी? Optic nerve. This will be called as the afferent nerve, and then definitely it is going to cause stimulation of which nerves or which muscles? Definitely it is going to cause stimulation of which muscles? So definitely pupils. So it is going to cause stimulation of the pupillary muscles, and due to that definitely there is going to be constriction of the pupil usually. Okay, so that is what is seen. तो क्या हो जाता है normally? Meiosis हो जाता है इसकी वजह से. Got it? But यहाँ पे क्या हो रहा है? Your optic nerve is damaged. तो तुम्हारी afferent कैसी है? Damaged है. अगर afferent damage है तो definitely will there be sensation of the light? No. And if there is no sensation of the light, so will there be any pupillary reflex? No. So if the optic nerve is completely damaged, there is total absence of the afferent nerve, and therefore there is a total afferent pupillary defect known as amyurotic pupil, which is seen in a patient of optic nerve damage. If there is a partial optic nerve damage है but कैसी? Partially. Then in that condition, usually it is which condition? Optic neuritis. Optic neuritis is what? Inflammation of the optic nerve usually. Okay, so in a patient of optic neuritis, when there is partial damage to the optic nerve, in that condition definitely what the patient is going to have a Marcus gun pupil. मतलब यहाँ पे तुम्हारी optic nerve पूरी तरह से damage नहीं है, so it is going to take the sensations, but normally or abnormally, and that is the reason definitely जब तुम क्या करते हो, जब तुम light flash करते हो तो pupils constrict होते क्या? नहीं, वो rather क्या हो जाते हैं? Dilate, and that is RAPD, that is your relative afferent pupillary defect usually, and that is seen in a patient of optic neuritis. And optic neuritis का most common cause क्या होता है? Multiple sclerosis. So she is having a left relative afferent pupillary defect. Fundoscopy reveals a pale, swollen left optic disc with some flame-shaped hemorrhages. The right eye is entirely normal. An urgent erythrocyte sedimentation rate ESR करा गया, which showed 72 millimeters per hour. Normal कितना होता है? 0 to 29 millimeters per hour होता है. इतना यहाँ कितना है? 72 millimeters per hour है. Which one of the following management options should be carried out first? So what is your diagnosis over here more likely? It is a case of multiple sclerosis. See, elderly patient with sudden loss of vision. Okay, sudden loss of vision हो गया because there was inflammation of the optic nerve. That means the patient was having optic neuritis. Therefore, the patient comes to us in emergency. She was also having left-sided headache over the past few weeks with tenderness of her head when she brushes the hair. As I've told you, electric current या shock-like sensations at the patient में, that is known as the Lermite sign usually. Okay, on examination, her vision is usually reduced to counting fingers in the left eye. A left relative afferent pupillary defect is present. Fundoscopy shows a pale, swollen left optic disc and flame-shaped hemorrhages. All of these are signs of inflammation itself. That means all of these are signs of inflammatory optic neuritis. Okay? So definitely, an ESR elevation also is suggestive of an inflammatory condition itself. So यहाँ पे it is a case of classical multiple sclerosis itself. तो multiple sclerosis में क्या करते हो बताओ? Option A says temporal artery biopsy. Temporal artery biopsy will be done in a patient of giant cell arteritis or a temporal arteritis. यहाँ पे giant cell या temporal arteritis है क्या? So important is there is tenderness of head या headache हो सकता है patient में. But usually in a patient of temporal arteritis or giant cell arteritis, there is a sudden blindness which occurs in the patient due to involvement of the ophthalmic artery. Okay, so that is what is seen, not a RAPD which is seen. Okay, next important is option B says ophthalmic outpatient review. No, you have to admit the patient. Administration of high dose corticosteroids. Yes, administration of high dose systemic corticosteroids. That is nothing but IV. कौन सी देते हो drug? Methylprednisolone. You have to give IV methylprednisolone to the patient. Option D says automated visual field assessment. Visual field assessment will be done But will it be the first management in the patient? No, the first management has to be high dose systemic corticosteroids. So this is the case of multiple sclerosis. Yaad rakhna, in a patient of multiple sclerosis, the most important symptoms are going to be the visual symptoms, jahan pe patient might have nystagmus. Most importantly, optic neuritis and diplopia will be there. Second, the patient can have motor symptoms like there will be slurring or stuttering of speech and there will be dysphagia. All of these are the features due to muscle weakness. Okay? The patient can even have spasms, there will be weakness, and there will be decreased sensations. All of these decreased sensation features, there will be burning sensation, tingling sensation, paresthesias, numbness. All of these will be seen. So these are the important features. So मैं इतना याद रखना है. Mainly muscle weakness याद रखना है और visual symptoms याद रखना है. What is the investigation of choice? As I've told you, see, upper motor neuron signs देखेंगे, Uthoff's phenomena, Lerner's sign, and afferent pupillary defect. What is done for diagnosis? It is the investigation of choices, a gadolinium enhanced MRI. And on that gadolinium enhanced MRI, you can see gliosis. Gliosis is actually due to the inflammation. And these are known as which figures classically? Very good. These are the classical Dawson figures which are seen. These are the classical Dawson figures which are going to be seen. And treatment, as I've told you, if the patient comes to in the emergency with an acute episode of multiple sclerosis, the treatment has to be IV methylprednisolone. Okay? And if we have to discharge the patient, we have to discharge the patient on an oral prednisolone drug. कोई दिक्कत नहीं है यहाँ तक. So that is important. Question number 17, it states, the below given procedure has been performed for which condition in the patient? कौन सी condition के लिए perform करते? What is the procedure first of all? What is the procedure? Definitely, iris में एक hole दिख रहा है छोटा सा. That means it is a iridotomy, and it is in the periphery of the iris. So this is what is called as a peripheral laser iridotomy. If I talk about a peripheral laser iridotomy, बच्चों, if I talk about a peripheral laser iridotomy, definitely. So please remember, it is done for which condition? Option A says primary open angle glaucoma. Now, if I talk about open angle glaucoma, okay, open angle glaucoma is usually of two types. It can be primary or secondary open angle glaucoma. So, जो primary open angle glaucoma है, it is commonly seen in which patient? Old or young? Old. Yeah, secondary is seen in young patient. What is the cause of primary open angle glaucoma? इसका मतलब क्या है? कि angle तो open है, then also there is impaired drainage of the aqueous humor. Q? Very good. There is fibrosis or there is sclerosis of the trabecular meshwork. तो एज रिलेटेड फाइब्रोसिस या स्क्लेरोसिस हो जाता है ट्रेबेकुलर मेशवर्क का, जिसकी वजह से द aqueous humor is not able to drain via the trabecular meshwork. Next, in young patient, what is going to happen? The cause can be in a young patient, the cause can be either a hyphema or, for example, an inflammation. क्यों? Hyphema में क्या होता है? There is bleeding in the anterior chamber, and this blood is going to block the trabecular meshwork. Or in inflammation, what happens? There is infiltration of cells and proteins. So these cells and proteins are going to block the trabecular meshwork. Angle तो open है, but trabecular meshwork is blocked, and that is the reason definitely the patient is going to have increased intraocular pressure because the aqueous humor is not able to drain. So that is the case of secondary open angle glaucoma. Open angle glaucoma के लिए drug of choice क्या है? The drug of choice are prostaglandin analogs, drugs like latanoprost, vimatoprost. Okay, so all of these are the drug of choice. No issues with this. So अगर I'm coming back to the options. Option A says primary open angle glaucoma. So primary open angle glaucoma में do we go for this peripheral laser iridotomy? क्योंकि एंगल तो क्या है? Open है definitely. Okay. If we have to do, what we are going to do? We are going to open the trabecular meshwork. We are not going to make a hole in the iris because the angle is open. Okay, so that is not done in either primary or secondary open angle glaucoma. Option C says angle closure glaucoma. Do we do in this? Yes. In angle closure glaucoma, क्या हो जाता है? क्या बन जाते हैं बच्चों? Synechia बन जाते हैं. If this synechia are less than 180 degrees, तो treatment क्या है? Peripheral laser iridotomy. But if these synechia are more than 180 degree, so definitely you have to remember, then the treatment is going to be trabeculoplasty. Okay, then the treatment is going to be trabeculoplasty. You have to repair the trabecular meshwork itself. Trabeculoplasty has to be done. Agar if there are more than 180 degrees of synecdoche which are formed. Okay, it's better rather than to open the synecdoche, it's better to repair your trabecular meshwork itself. Okay, so here it is, the answer is option C, that is your angle closure glaucoma में treatment करते हैं. Is it a treatment for corneal dystrophy? No. ठीक है. Question number 18, बच्चों, it states a 50 years old male suffers from a penetrating injury to his left eye while ripping the plywood on his table saw at home. The wood splinter is removed and there appears to be a partial uveal prolapse, but he still has vision in the left eye. 3 weeks later, he has difficulty in reading the book definitely. Photophobia is there, that is irritation to light, and there is a blurred vision as well in his right eye. And there is also choroidal infiltrates which are seen on the fundoscopic examination. What is the most likely diagnosis? तो 50-year-old मेल है, कैसी टाइप की इंजरी हुई है? पेनिट्रेटिंग इंजरी. किस आई को हुई है? लेफ्ट आई को. और कब हुई है? While he was repairing the plywood. तो मतलब किससे हुई है? प्लाईवुड से या वुड से? So definitely which kind of trauma? Vegetative trauma to the eye. There is a history of vegetative trauma to the eye. Vegetative trauma की history होगी. So there are two features which should come to your mind. One is definitely sympathetic ophthalmia and the second is a fungal corneal ulcer. Next, definitely there appears to be a partial uveal prolapse. He has a vision in the left eye. 3 weeks later क्या हो जाता है? Definitely now उसका vision loss होना शुरू हो जाता है. He's having difficulty in reading book, photophobia and a blurring of vision as well. And there are choroidal infiltrates. Infiltration क्या होता है? Collection of cells and proteins is what is called as infiltrates. कहाँ उसके infiltrate हुए? Choroid में. Choroid is which layer? Second layer, that is uvea. It is a part of uvea itself. अगर choroid में infiltration हो रहा है, infiltration is a sign of inflammation. तो choroid का क्या हो चुका है? Inflammation हो चुका है. And choroid का inflammation मतलब uvea का inflammation. That is what is uveitis. The patient has developed definitely. ठीक है? And what is seen on this? These are infiltrates itself. क्या बोलते हैं इनको? बोलो. These are classically known as the Dallen-Fuchs nodules. Okay, and Dallen-Fuchs nodules are a characteristic feature of. They are a characteristic feature of sympathetic ophthalmia or ophthalmitis. Important is sympathetic ophthalmia or ophthalmitis. क्या है ये? It is due to which kind of a trauma? So important is, ये question पूछा जा चुका है. What is the risk factor for sympathetic ophthalmia? Answer is a penetrating trauma to the eye. Second important, vegetative trauma is also important risk factor for sympathetic ophthalmia. Okay, and due to that, the patient is going to develop what? Bilateral granulomatous panoveitis. The patient is going to develop what? Bilateral granulomatous panoveitis. No issues with this, anybody? तो याद रखो, panoveitis का मतलब क्या होता है? Definitely, the patient is not having inflammation only in one layer of the uvea, but rather the whole uvea. Matlab, the patient is having iritis, iridocyclitis, pars planitis. There is also choroiditis. All these layers are inflamed. That is what is the case of panoveitis. And why bilateral injury? तो एक आंख को हुई है. It is due to sympathetic overactivity. As there is sympathetic overactivity, you have to remember definitely the patient is going to have inflammation in the other eye also. ठीक है, एक आंख का inflammation दूसरी आंख में भी फैलेगा, but उसमें time लगेगा. ठीक है, so one eye is completely gone and the second eye will also be gone. तो अगर दूसरी आंख को बचाना है तो affected eye या जो injured eye उसको क्या करना पड़ेगा? निकालना पड़ेगा. So therefore, if I talk about sympathetic ophthalmia, first in the initial stages, what you try to do? What is the treatment? What is the treatment, बच्चों? So definitely in the first one, you are going to go for intravitreal steroids. ठीक है? The first line of management will be intravitreal steroids. क्यों? क्या है? Panoveitis है ना? That is inflammation of the uvea. So therefore, inflammation को कैसे treat करोगे? With the help of steroids. So you have to give intravitreal steroids. If that fails, then you have to go for what? Enucleation of normal or affected eye. So please remember, enucleation of the affected eye has to be done. So that is important. नहीं, वो अम्बलायोपिया वाला फंडा अप्लाई कर दोगे, इससे बोला मैंने। नेक्स्ट इंपॉर्टेंट है, ये क्यों निकालनी है अफेक्टेड आई? जो तुम्हारी नॉर्मल आई उसको बचाने के लिए। अदरवाइज व्हाट इज गोइंग टू हैपन इफ यू लीव दिस अफेक्टेड आई ओवर देयर, द इन्फ्लेमेशन इज गोइंग टू स्प्रेड टू द अनदर आई आल्सो एंड इट इज गोइंग टू डैमेज द अनदर आई एज वेल। कोई दिक्कत नहीं है इसमें, दैट हैज टू बी रिमेंबर्ड। दिस Dallen-Fuchs nodule has been a previous year question बच्चों, so please be aware of that, ठीक है? So that is important. याद रखना aspergillosis or your fungal ulcer वगैरह, it would have been there, but the problem is they have spoken about clearly about choroidal infiltrates and they have given Dallen-Fuchs nodules in the image also. So it is nothing about cornea. It is actually about the second layer known as the choroid or the uvea. Okay, so that is the important feature. ठीक है? Sarcoidosis में the patient only develops what? Sarcoidosis में the patient develops panuveitis or only choroiditis? So the patient mainly develops choroiditis in the in a case of sarcoidosis. Even the patient can develop pars planitis also. ठीक है, pars planitis भी हो सकता है and choroiditis भी हो सकता है. But again, कोई भी sarcoidosis की हिस्ट्री दिख रही है क्या? Middle age female, presenting with dyspnea, lupus pernio, bilateral hilar lymphadenopathy, कोई भी हिस्ट्री है क्या? No. तो उसके बिना ocular manifestations इतने जल्दी नहीं आते. There should have been history of all these features. ठीक है? Undiagnosed trauma, it is not a case of undiagnosed trauma. What is this, anybody? This is what is known as evisceration. Okay, and evisceration is what? Removal of the inner layers of eyeball. It is done in which condition, bachcho? Refractory endophthalmitis. What do I mean by refractory endophthalmitis? If the endophthalmitis did not respond to antibiotics and steroids, in that condition I have to go for evisceration. Okay, no issues with this, anybody? Next is, what is this, bachcho? Enucleation. Enucleation matlab removal of the whole eyeball. Okay, removal of the whole eyeball along with the sclera, but leaving behind the extraocular muscle. Unko nahi nikalte ho. Enucleation is done in two conditions. One is sympathetic ophthalmia and second is retinoblastoma. कोई दिक्कत नहीं है इसमें. And the third one is this. What is this? This is what is known as removal of the orbit, called as exenteration, and exenteration is done for mucormycosis. Ocular mucormycosis may we go for exenteration, that is debridement. Question number 19. A patient with clinically significant diabetic macular edema with non-progressive diabetic retinopathy was treated with a macular grade photocoagulation laser के साथ. The patient still have vitreomacular traction. What is the preferred treatment in this patient? Now, सबसे पहले, for a patient of diabetes mellitus, when a diabetic retinopathy develops, सबसे पहले कौन सी diabetic retinopathy होती है? Non-proliferative diabetic retinopathy, where the patient will have earliest lesion. What is that earliest lesion? Due to loss of pericytes, there will be dilatation of vessel, microaneurysms. Then it can further progress to various types of hemorrhages, dot plot or flame-shaped hemorrhages. There will be small yellow spots known as the exudates. Okay, these are known as hard exudates. Then there will be large fluffy exudates known as the cotton wool spots. These are the features of NPDR, non-proliferative diabetic retinopathy. Then definitely the patient develops into PDR. What is PDR? Proliferative diabetic retinopathy. Now, proliferative diabetic retinopathy means there is proliferation. Or proliferation का मतलब क्या? There is formation of new vessels. So proliferative diabetic retinopathy is nothing but neoangiogenesis. There is neoangiogenesis in the patient's eye. Neoangiogenesis or new vessels are getting formed. अब ये जो नई vessels बनी है बच्चों, ये strong है या बहुत ज्यादा weak है? Weak है, ठीक है, immature है. Therefore, they are going to rupture, and as they rupture, definitely they keep on rupturing again and again, and therefore they are going to cause vitreous hemorrhage. अगर vitreous hemorrhage होता है, the patient is going to have decreased blood supply, and that is what is known as hemorrhage. हुआ ना, तो blood बाहर leak out कर रहा है, तो enough blood supply मिलेगा क्या? नहीं मिलेगा, तो there will be ischemia, and ischemia further causes hypoxia. और जब hypoxia होता है, there is stimulation of which growth factor? VEGF, vascular endothelial growth factor. In vascular endothelial growth factor की वजह से definitely more and more blood vessels are going to form again. ठीक है, अब ये जो नई blood vessels बनेंगी again, what it is going to happen? See, these new blood vessels, first to मैंने बोला, they are going to rupture easily and therefore they are going to rupture easily, therefore they are going to cause recurrent vitreous hemorrhage. Second feature, these new blood vessels will grow over the vitreous, and जैसे ही vitreous के ऊपर grow करेंगी, they are going to pull the retina towards them. As they pull the retina towards them, they are going to cause which type of retinal detachment? They are going to cause tractional retinal detachment. And when these new blood vessels will grow inside the anterior chamber and they are going to block the anterior chamber definitely, will there be drainage of aqueous? No. Increase intraocular pressure, and that leads to glaucoma. As this glaucoma is due to formation of new vessels, that is called as which type of glaucoma? Neovascular glaucoma, also known as 100-day glaucoma. कोई दिक्कत नहीं है. So that is the feature which is seen in a patient of diabetic retinopathy, mainly a patient of proliferative diabetic retinopathy. ठीक है? So that has to be remembered. Now, इसके लिए definitely in a patient of non-progressive diabetic retinopathy, the patient was treated for his macular edema. And what was the treatment? Macular grade photocoagulation was done. The patient still has vitreomacular traction. अभी भी अगर vitreomacular traction है, that means the vitreous is pulling the macula towards it. And therefore, there are very high chances of retinal detachment. Which one? Tractional retinal detachment. This condition में preferred treatment क्या होगी? So option D says augmented macular photocoagulation. That is not the option. Okay, again going for photocoagulation is not going to help in this patient. Option C says repeat macular grade photocoagulation. Again not option. Option A or B. Either it is intravitreal bevacizumab or pars plana vitrectomy. See, bevacizumab or ranibizumab are definitely the anti-VEGF drugs. Okay, these anti-VEGF drugs are going to stop new vessel formation. But are they going to improve the previous vessel? Are they going to damage the previous vessel? No. जो already बनी हुई है उनका क्या? That is the problem. Okay, we will give injection of bevacizumab, but to stop the further progression. अभी जो उसका vitreomacular traction हो रहा है, उसके लिए what we have to do is we have to go for a PPV. That is a pars plana vitrectomy. No issues with this. It will stop the progression further, but it is not going to help right now. Question number 20. इसके बाद break ले लो भले. A 60-year-old chronic smoker complains of breathlessness and discomfort. Chest X-ray reveals a mass in the superior sulcus as given below. Can you see there is a mass in the superior sulcus of the lung? Definitely. And further investigations were advised. He presents in the emergency room and has been admitted to the hospital with drooping of right eyelid. ठीक है, यहाँ क्या दिख रहा है? Definitely he is having a drooping of eyelid. Which of the following additional signs on the right side would confirm the diagnosis? यहाँ शायद मैंने गलती से left वाले डाल दिया, so consider it to be the right side. ठीक है, no issues with this anybody? So what is the likely case? It is a provisional diagnosis of Horner's syndrome. Why it is the case of Horner's, बच्चों? This patient is having a mass in the superior sulcus. And what is the superior sulcus tumor of lung called as? It is a classical Pancoast tumor. And we know that this Pancoast tumor, which is present in the superior sulcus of the tongue, it is going to compress which chain? It is going to compress the cervical sympathetic chain. It is going to compress the cervical sympathetic chain. And as it compresses the cervical sympathetic chain, जो sympathetic nerve होती है वो क्या हो जाएगी? Paralyzed. The sympathetic nerve will be paralyzed. Sympathetic nerve usually supplies two things in the eye. Sympathetic nerve is going to supply two important things in the eye. First is the dilator pupillae muscle. If sympathetic nerve is injured or paralyzed, dilator pupillae muscle is also paralyzed. What is the function of dilator pupillae? It is going to cause mydriasis or dilatation of pupil. But if that dilator pupillae muscle is not working, will there be dilatation of pupil? No. So there will be constriction of pupil. That is what is called as meiosis. And second important, it also supplies which muscle? Muller's muscle. Muller's muscle is a primary elevator of eyelid or the secondary elevator of eyelid. So the primary elevator is your LPS, levator palpebrae superioris. उसको मदद करने वाली is Muller's muscle. ठीक है? So if there is sympathetic nerve injury, Muller's muscle will also be paralyzed. तो patient में there will be drooping of eyelid. Completely eye open हो पाएगी क्या? नहीं open हो पाती. But as the LPS muscle is not paralyzed, will there be complete ptosis or partial ptosis? So Muller's is only a helping muscle. अगर वो paralyzed हो जाती है, the patient will only have a partial ptosis. Okay, so this is the case of Horner syndrome. The mnemonic to remember it is known as perfect meal. What is perfect meal? Perfect stands for partial ptosis. M stands for meiosis. E stands for enophthalmos or exophthalmos. So as you can see, there is meiosis in the patient. There is drooping of eyelid. This eye appears to be sunken. ऐसा लग रहा है धसी हुई आंख है इस side पे. So this is what is the apparent enophthalmos. Okay, the patient is going to have a apparent enophthalmos. धसी हुई आंख लगती है. ठीक है? Then A stands for what? Anhidrosis. What is anhidrosis? Absence of sweating on the same side or the opposite side? Same side. That is the ipsilateral side. And L for what? Loss of seriospinal reflex. L for what? The loss of seriospinal reflex. No issues with this, anybody? So now they have asked you that on the affected side or on the right side, which one of the following is going to confirm the diagnosis? Option A says dilated pupil. Will there be a dilated or constricted pupil on the affected side? Constricted. Apparent exophthalmos or enophthalmos? Enophthalmos. Absence of sweating on the affected side? Yes. That is anhidrosis on the ipsilateral side is going to confirm the diagnosis. Will there be dryness of eyes? No. There will be dryness of face. This is a classical case of कौन है ये? ठीक है? So that is important. Take a break for 15 minutes and then join back as soon as possible. ये क्या बता? कितने गलत है? हैं? 20 में से